Hi, good morning, everyone. My name is Dr. Bakhtar Ahmad. I am the founder of The Medic Life. I'm also a junior doctor currently working in Hampshire. First thing first, I wanted to introduce all of you guys to this event that we're going to be doing today. So challenges in healthcare. Can I just request you guys just to pop on your cameras just so we can, make it a bit realistic? I'm sure halfway through 2021, we're kind of used to Zoom and everything. Just want to get a bit of normality back. So we have hosted an amazing event for you guys today, mainly focusing on the challenges that you guys are, whether you're currently facing in healthcare, if you're someone who works in healthcare, if you're a student of some sort, or a lot of you guys are prospective medics or dentists going on in the future, in which case you guys are going to be the future of healthcare. So we just want to make you aware of some of the challenges that await you, and also how you can tackle those. So first things first, let's go on to talk about what we're going to do today. And again, thank you all of you for being so prompt and on time today. We've got an amazing audience, so already we are just under 250. So today we're just going to talk about why this event is so important. I'm going to give you guys a bit of a brief introduction, and then I'm going to hand it over to Dr. Daniel Gearon, who is the founder of a charity called UCAT Doc. And we're working with this charity on this event today to kind of outline some of the hurdles that await medicine and dentistry as well. And pretty much all the other healthcare professionals, that kind of the challenges that they face and what kind of support that is available out there for that. Then we're going to hear from Dr. Melisa Padashi on the challenges in dentistry. And then we've got Dr. Sunmeet Kandhari and Dr. Navneet Kandhari, who are twins. One's a junior doctor, one's a junior dentist. They're going to be talking to you guys about well-being and motivation. And again, a lot of you guys who are currently applying for medicine or dentistry, talk about some of the challenges that await you over the next couple of months and how to deal with those. We'll then do kind of a big Q&A. We'll do a short Q&A after each talk, but then a big Q&A at that point. And then after that, I'll be taking you guys through a personal statement workshop. Again, this is for you guys if you are applying for medicine or dentistry, how to structure your personal statements. We're going to be using real examples. We're going to be using things that work well, things that don't work so well, give you guys some ideas and so on. And then finally, because UCAT test bookings are opening tomorrow, this is the perfect time to talk to you guys about how to organize your UCAT preparation. And then we'll do the feedback and certificates afterwards. Now, this event is being recorded, but only the speakers and the shared screen will be recorded. So you guys are not going to get recorded for that. And just to let you guys know in terms of data policies and things like this. And then certificates are only available for our live attendees. So for you guys here today, and at some point today, I will send the certificate out and give you guys the details just to make sure that only people who attend eligible for the certificate, rightly so. So a few ground rules very quickly. First of all, because of safeguarding issues and things like that, we've got some minors with us today. So there's no chat feature available. So if you want to ask a question, you can ask that through Instagram. So if you go on Instagram, The Medic Life, I'm sure a lot of you already follow it now. If you don't, go ahead and follow that. So the.medic.life. And I've put up a story that looks like that. You may have to skip through a few. And that's where you can pop in your questions. So I will read through your questions, obviously filter any if needed, and then ask the presenters those questions on your behalf. Certificates, as I said earlier, it's one of the things that everyone wants to have one. So for the work experience series, again, it's important for our guests who are applying for medicine or dentistry to have your portfolio full of your certificates, and therefore every event that you come to, if you participate in it, we'll issue you with a certificate at the end, which will be certified. Right, just getting through some of the boring stuff, so bear with me on that. And then next thing, this is quite interesting. So again, for those of you guys applying for medicine or dentistry, if you are someone who thinks that you will need personal statement support later on, now the Medic Life, we don't believe in charging for personal statement reviews. I just don't agree with it. I know a lot of companies do it, and fair enough, up to them. But at the Medic Life, we just don't like charging people money just to review your personal statement, because So, but at the same time, obviously all the team members, we all work either working full-time doctors or med or dental students. And in that case, we just don't have that much time to make sure that we review every single personal statement. So the only way you get one to make it fair is we do personal statement prize draws quite frequently, actually. We did one last night. So we're going to be doing another one today for this event. So at some point today, if you are interested in having a personal statement review, you can enter the prize draw by taking a picture of the screen even, or any of the screens later on, put it on Instagram, tag the Medic Life, tag the Dentist Life, just so I can see it. And then I will reveal the winner later on tonight. All right, so just want to thank you all for joining today. We've got just under 300 participants, so that is absolutely incredible. I also want to introduce you guys to our sponsor. So it was on that screen. So we've got the Medical Defense Union who are sponsoring the event today. So for those of you guys, I know we've got loads of different audience from different backgrounds today. Some are med students, some of you guys are even newly qualified, or you'll be graduating doctors in the summer or dentists. So in that case, the Medical Defense Union, just for all of you to be aware of, is an organization that provides indemnity and basically protects you in case as a doctor or a dentist or as a healthcare professional, you make any errors or mistakes. So they are sponsoring this event. 100% of their proceedings that have come to me will be going to the charity UCAT Doc as well. And then, of course, we'll be playing a little video from MDU later on throughout the day at some point. Right, so the first guest, I am very, very excited to have Dr. Daniel Gearon, who is a previous tennis athlete. He started medicine at the age of 24 and is currently a surgical trainee in Cambridge. So Daniel started the charity UOK Doc after some personal life events, and BBC actually did a short clip on the charity. So I'm going to go ahead and play that now for you guys. It's about 4 minutes long, and then after that, I'll hand it over to Dan, and then we'll take it from there. So just bear with me whilst I pull up that documentary or that clip for you guys. So it will lag very slightly at the beginning. I've tested it. At the beginning, it will lag slightly, but then after that, it should kind of balance out as Zoom gathers the data. So just bear with it, and that should work for you guys.
I had a phone call from my sister saying that Liz had taken her own life, and that experience and that time was extremely difficult for me. I'd never lost anyone to suicide, and it really kind of blew my world apart. Liz was a cousin of mine who was also a consultant anaesthetist at a London hospital, and I had the pleasure and privilege of shadowing her. Liz kind of took me under her wing, and she was a real kind of mentor. It's a place where they can talk about their days, relate to each other, normalise what they're feeling, and then go on with their next day.
If somebody's saying they're feeling suicidal, it's not to say, well, you're just attention seeking. They're not, they're in pain. That's one of the things we need to change for doctors, that there is help out there, but we need to get people to ask. I know she'd be incredibly proud of him, as am I. It's kind of, he didn't need to do any of this. It's acknowledging that everybody's vulnerable, everybody can be vulnerable, and doctors are no different.
We always really want to care for our patients, but we're not going to be able to care for our patients if we can't look after ourselves. And I think now more than ever, especially as the second wave of the pandemic starts to subside, we really need to look at ourselves, look at our mental health, look at our well-being.
The hardest part of working the pandemic was probably not being able to do enough for some patients, and I can't honestly tell you how that made us all feel.
This is just the tip of the iceberg when it comes to the impact mental health is going to have on doctors' lives.
Ultimately, as an industry, we need to try and bring down the rate of burnout and also the rates of suicide as well, nationwide.
One of the things about the charity is it's very clear how under-resourced and in some ways ignorant of the need for well-being and mental health resources for doctors. So the charity is very much about beginning a conversation, beginning to normalise some of the inevitable emotional consequences of what they have to do day to day.
We're uniquely vulnerable. We see a lot of very emotionally taxing things, people dying, people suffering, and people who are very emotional about the health difficulties that they're going through.
It's quite lonely, and I've experienced a bit of anxiety because of that.
If I could have said anything to Liz, then it would be that there is still hope, even though things feel so tough today. You've got people around you who can help you through. If this conversation helps one other doctor say, right, I'm not feeling great, I need to get some help. I think we've been talking about it for such a long time that we have to say, now's the time for it to change.
You're kind of helping change the future. Like, my aim would be in 10 years' time that UCAT Doc is not in existence, because this is not a problem anymore.
Right, guys, so I actually came across that video not too long ago, and I was thoroughly moved by, you know, everything that is portrayed in it. And as a junior doctor who's only started about 2 years ago, for some reason, doctors just tend to believe that we're indestructible. We see so much at work, you know, it's a high stress job, it's a highly pressured job. And at the end of the day, we are humans as well. So it's very important for everyone to be aware. One of the reasons we wanted to do this event is to raise awareness of how important mental health is in healthcare, and the challenges that surround us, to make it more normal to seek support if needed. But also, more importantly, you know, as one of the things that Daniel said in the talk, that hopefully we're hoping in 10 years time, you know, we won't need charities like this, because it will be so easy for doctors or dentists or other healthcare professionals to be able to deal and talk about their issues. And as you guys, a lot of you guys are the future doctors and dentists in the next 5 to 10 years time. This is something that really kind of relates to you, and is something that is everyone's responsibility to help change. So what we're going to do, Dan, I'm just going to take off my screen and I'll get you to come on. So thank you very much for taking the time out of your very busy schedule to come along today. Go ahead and see if you can share your screen. You should be able to do that now.
Perfect. Give me 1 second. Just want to make sure that's the right one. Can you guys hear me?
Yeah, all good. See you. We can see you. We can hear you. We can see your screen as well. Perfect.
Perfect. Okay. Thanks very much for the very kind introduction, everyone. My name is Daniel Gearon. I'm a core surgical trainee here in Cambridge at Royal Papworth Hospital in cardiothoracics. I'm also a master's student with the Cambridge Judge Business School in Entrepreneurship. And I entered medicine as a postgraduate, as you very kindly said. Like I said, thank you for the introduction. Thank you for allowing me to have the time speaking here. It's really a great privilege, and it's so good to see so many of you out here on a Sunday morning. It's actually really impressive. So thank you for your time. I just wanted to start off, you know, obviously I realize some of you are med students and some of you are A-level students, probably about to take the UCAT. I just wanted to tell you a little bit about my background before I delve into doctors' mental health. I think it will help some of you. So I left the UK at 16 after my GCSEs. I didn't do A-levels, and I went to a tennis academy in Florida. In my GCSEs, I didn't do very well, but I wasn't focused on GCSEs. In fact, I wasn't really focused on academics at all. And I did 8 GCSEs. I think the majority were Cs with some Bs. I didn't get any As whatsoever. I then went to the tennis academy, like I said, and then went on to a tennis scholarship at a university in South Carolina, and played there for 4 years, and essentially decided not to go professional, and decided I wanted to become a doctor. So I did a bioscience degree, or I started a bioscience degree, which is the equivalent to a pre-med degree over here. And I was accepted into a UK medical school, the University of East Anglia, in 2010. So my path into medicine was not a simple one. It wasn't a planned one. And my first degree when I was playing tennis was in communications and media. I didn't pay much attention in that either because I was focused on tennis. So I think that there'll be some of you, I'm sure the majority of you will be getting into medical school. There'll be some that won't. And I think, that, like, the reason why I'm telling you that, my story is that, there's more than one way to skin a cat, and it may take a few attempts to get into medical school. I know some of my colleagues that are now very good surgeons and also very good GPs, they applied several times to get into medical school. And they had a similar background to me, where they played sport beforehand, or they went on and did a postgraduate degree and then went into medical school. So hopefully that gives you some courage if things don't go your way over the next year. So I am also the founder for UOK Doc. We're a mental health and wellbeing charity for doctors and also medical students as well. It was a charity that was largely founded, as you've seen in the BBC News video, upon personal experiences, but also I've drawn a lot on my athletic background into what I feel that doctors and dentists, and I think actually every professional, lawyers, everyone kind of needs in their life. So I'll go on and talk. There we go. So you've heard of the story in the BBC News video, but essentially, just to recap, I lost my cousin to suicide in 2016. I shadowed her for my internal elective, actually after losing my father in 2013. And I shadowed her at King's on the liver transplant team there. She was, just to tell you a little bit about Liz, she flew through medical school. She's not like me. She went in, she did her A-levels, went to medical school, was a consultant by the age of 32, 33, and kind of stayed in the King's hospital throughout her medical career. Supremely intelligent, and as cousins go, we were quite close, purely because of our family circumstances and what happened with my dad, and then obviously shadowing her at King's. Her death happened in 2016. It was unexpected. It was tough to deal with. And it was only a couple of years later, after I actually turned down a core surgical training position in Leicester, and I thought that I should do something with my year. And that was when I started the charity, or at least it came about as an initial idea in 2018. So that's a bit about the background to flesh out the BBC News story. And I've been asked to kind of have a chat to you about the importance of mental health in medicine. And I appreciate there's also dentistry students and dentistry talks here as well that are occurring. So I'm sure it's the same in that profession. Medicine and dentistry, and I remember being told this at the beginning of medical school at UEA by the dean, and he said, life will happen. And life did happen to me during medical school. And what he meant by that was that you will end relationships, you will start new relationships, you will have bereavements, you'll have family deaths, you may get married, you may get divorced, you may have children. And that is really, those events have got nothing to do with you being a medical student or a doctor. That's you as a person, as a human being, that's you living your life. And those are life events that will happen. And building upon what he said, is that life will happen, and actually it's really important to communicate that not only with the university or hospital that you're with, but also your peers, your friends, your family. As doctors, I think we can take it upon ourselves, and medical students, to come across quite stoical. And trust me, I'm a core surgical trainee at a highly intense hospital, and we always want to put our best foot right, despite our mental health sometimes and our physical health. And actually, it's really important that we prioritize both those, physical and mental health, instead. Because if you do that, you'll ultimately be able to deliver a really high level of patient care, and also a safe level of patient care. And you'll ultimately get more respect from your colleagues as well. And you'll feel better. That's the most important thing, is that you'll feel better in yourself. And as many of you know and are aware, medicine is hard. The more I've done research and the more I've progressed with my master's in business, I've realized that actually every profession is really hard and has long hours. But medicine does have its unique challenges. As doctors, you will have to make life and death decisions. There will be times where you feel that you're maybe not as supported as you should be. Those life and death decisions you will be making, but your friends that maybe didn't go into medicine will not be making. And it will be quite difficult for them to relate to you. You'll be trained, and you are trained to rationalize those life and death decisions. And I think for the most part, we're trained really well actually in that. But that doesn't mean that we don't take those decisions home and that they don't weigh on us. And I think that is something that is very unique to doctors. And I think that although at work we can maybe carry out a cardiac arrest supremely well, I was in one only a few weeks ago and it went unbelievably well, it doesn't stop the fact that someone's had a cardiac arrest. And it does, you can feel it within the room, that there's a palpable kind of almost sadness in the room when that occurs. So I think it's really important just to acknowledge that these things happen, and to talk about these things, so your mental health, your emotional health, and your well-being to your colleagues, and if not to your colleagues, to your friends, because by doing that, by sharing it with your friends, but also by your colleagues, you're creating a bond. And actually, a lot of research suggests that to take a few steps back, resilience is a big word that's thrown around. I don't particularly like it, but I do like it in this circumstance, is that resilience is built between the individuals. And what is meant by that is that resilience is built between the team members. So I remember as an F1, I was on an extremely busy job here in Cambridge, actually, on a colorectal firm. And although it was probably one of the hardest jobs I've ever done, I had an amazing time purely because the team that I was in was brilliant. So I was working the longest hours, but yeah, it was one of the happiest times I've had in medicine so far. And I think that's a great example of that. And there's lots of research done by Professor Greenberg, who's a patron for UCAT Doc within that area. Secondly, I've kind of drawn a lot upon my background in sport, and I really feel that doctors are akin to professional athletes. So if you look at a professional athlete, and even what I was doing 10, 15 years ago, I had a nutritionist, I had a sports psychologist, I had a coach, and if I was injured, I would stop playing, I would look after my injury, and then I would take myself back onto the court and play. I would go through the proper rehabilitation process. And it's something that actually as doctors, if we look at what we do, we go to work and we practice our medicine, we look after our patients. In fact, we go above and beyond at looking after our patients, but the very bottom of our list is looking after ourselves. And I think, to be a bit savvy, you have to look after yourself, because if you want to enter a competitive speciality or even a non-competitive speciality, if you want to be good in your area, you're going to have to be somewhat looking after your physical and mental and emotional health, just like athletes do. So eating the right food, making sure that you're exercising, but also keeping in tune with how you are mentally and how you're feeling. And if something's not going right, then going and seeking support. Athletes have been doing this for years, and it's slowly coming into the professional world. It's not quite there yet with doctors, but a load of my colleagues that are CEOs and founders of large startups have life coaches, for example, and that's to ensure that every area of their life is operating as smoothly as possible so they can get the most out of themselves for their job and for their startup. And I think it's really important that doctors begin to do that too. I think secondly, going back, and this relates to the first point I made, is that we are human, we all have our families, we have our friends, and I think sometimes especially when you come from A levels to straight into medicine. I was just talking this with one of my consultants the other day, actually, and then into core training, into your hospital job or your GP. You can become quite institutionalized, and actually you kind of become a bit blinkered, and actually there's a whole world out there. And sometimes it's okay if your training does not go according to plan, or you have to take a year out, or someone dies in your family and it hits you unexpectedly, and you have to take time for that. That is okay, and in general it won't affect the end point of your journey, which is ultimately becoming a GP, consultant, and whatever field you want to go into, or maybe it's leaving medicine as well. But all those things are those areas, emotional, mental, and physical well-being, are really important for you to look after and nurture. And you'll tend to find, because you've got some altruistic gene that maybe is slightly more than the general population, why you're doctors, that actually you put your own well-being kind of near the bottom. But I think as the generations progress through medicine, we're getting better at that. And just to build on that, prevention is better than cure, right? So I see that a hand is raised. I don't know if that's a question.
Dan, if there are any questions, we'll just do them at the end. So
okay.
Yeah.
Prevention is better than cure, and that's the same in medicine, right? Like you don't want a patient to have diabetes, you don't want a patient to have open heart surgery because of coronary artery disease. You want them to eat healthily, so they're not in your operating room. It's quite a barbaric place, surgery, for anyone. And as an athlete, I would avoid a surgeon at all costs. So, and it's the same with your mental and emotional and physical health. You want to look after it. You want to be in tune with it. You don't need to go over the top with it, but you just want to make sure that you're in balance and listen to it. So building upon those things is where kind of UOK Doc comes into being. I just want to talk to you about our services. So starting with our partnership with Shout, it's free for all NHS staff and medical students as well. It's a 24/7 text conversation service. It's completely confidential and it's always there in case you need someone to talk to. We've just recently launched our team event. We had our first team event last night. And the team event essentially is like the physical well-being side to UOK Doc's armory. And it's Pilates, breathing exercises, HIIT, workouts, all those kind of things. They'll occur weekly. And they're free for doctors and all NHS staff and medical students, and to non-NHS staff, it's £10. So do come along and join that. We had a great turnout yesterday, and I think it really went down well. I think it will be a good initiative. We also have the huddle. The huddle's every Wednesday at 7 p.m. And it's a common room of where doctors and medical students come together. They talk about their week. It's facilitated by our co-founder, who's a UKCP registered psychotherapist. It's not group therapy, but he does not lead it, but he does, get you to have a think about what's been going on with your week and why you've been feeling there's certain ways that you have been. And actually, it's proven really, really popular. We had some really good turnouts, and some of the best turnouts amongst all the services being offered from aligning charities and the BMA and things like that. So do come along to that if you wish. We've also done 2 lots of webinar series, and our last one was in partnership with First Responders First, which is an initiative of Harvard University and Thrive Global and the CAA Foundation. We had the CEO of Mind, Paul Farmer. We had the former WHO Mental Health Director, and also our patron, Shakar Saxena. We had the England rugby captain, Tom Mitchell, rugby sevens captain, Tom Mitchell. We had his sports psychotherapist, Kate Warrener, that came on. And we had the Doctor's Kitchen as well that came on and spoke with Tom and Casey as well. So we've had really amazing guests come onto our webinar series. And what we're doing now is actually putting those guests into our podcasts that we've launching our series 3 in July. We've got fantastic speakers for our Series 3. We've got cystic fibrosis endurance athlete by the name of Sophie Grace Holmes, who is phenomenal and is running 200 kilometers, I believe, over the summer in the world championship event. And we have some really, really great guests on that. So do tune into that, and that's available on Spotify and the Apple Podcasts as well. Like I said, these are our partners, and these are the main people that we do everything through. So everything that we do is evidence-based, which is really important to us. And our patrons really do keep that in check. So that's our partners. We do plan on launching a course called the CISA course, so after my cousin. And we've got a mental health advisory board, Soshi Carr, who's a former WHO mental health director that I spoke about earlier. Professor Greenberg, who has got a really amazing knowledge in PTSD and used to work with the armed forces. And then we've got Aman Kunar, who is a consultant thoracic surgeon here at Papworth and is also a good friend of mine. He will be on the mental health advisory board. We partnered with these organizations thus far, and we're going to be we're going to be launching the sleep module in due course alongside Papworth Hospital here in Cambridge. And then we'll also be working on the the stress, anxiety and burnout with Harvard University as well. So that's something to keep an eye out for. I think that'll be really, really good. It won't be too long. It will be free for you guys. We're planning to launch it through hospitals, and the hospitals seem to be wanting to adopt it, which is really fantastic news. Yeah, watch the space for that. I think it'll be great. Here's our team. We've got Lucy, who's our CFO. Chris, who really is an amazing psychotherapist, and he's got a really big emphasis in men's mental health. So we get quite a lot of the charities, including Practitioner Health, get a lot of females attending their service, but not many males. So Chris has proven quite a track record, especially with UK Doc and amongst kind of this industry, that he's very good at getting males to engage with their mental health, which is why we're so emphasized on high performance rather than just physical, mental and emotional health. We also have Meenal Galal, who I worked with at Adam Brooks. She's a consultant at John Radcliffe at Oxford, and Alex, who's one of our advisors. And lastly, we have an ambassador network. We have about 20 ambassadors, and the ambassadors are doctors, medical students, and they promote the charity, attend our events, come to our community events with them, and they come onto our podcast, be part of our webinars. Some of them are writing papers that we've been asked to write on behalf of UK Doc. I think the opportunities as an ambassador is a really good one. It's a really good leadership position for doctors and medical students to take up if you do want to become an ambassador. The contract is for 1 year with UK Doc, and there's certain very light kind of prerequisites that we require. Essentially, those are being engaged with UK Doc, so you're not just an ambassador not doing anything. But if you do want to become an ambassador, the email is on the next page, and I will share that with you. But I think it's a really fantastic role. I know a leadership position was something that I really struggled with for core surgical training, and a UK Doc ambassador, in my mind, qualifies you as a national leadership role because it's a national charity, or it's an international charity because we're over in America as well. So do you have a think about that? And I'm not sure if this will work. I put this in here. So we had Beverly Knight and Joss Stone did a music video last year for us, and the producers created a 3-minute video for us, but also a 30-second video. So I'll play that for you. If it doesn't work, just let me know and I'll stop and I'll move on to the last slide. And that is me done. Thank you for your attention today. And if you have any questions, you can email them into, well, you can ask me now or email them into info@uokdoc.org.uk. We've got an Instagram account at uokdoc, and our website there is there as well. Thank you.
And thank you so much for such an insightful and incredible talk, sharing some of the personal reasons behind starting the charity. And I'm so impressed by how far UK Doc has come in just a space of a few years, and obviously a lot of the services that are available. I think it's very, very useful. I particularly love the ambassador role as well, which I think, for a lot of our audience going into medical dental school, this is something definitely that you should think about once you start or get to a role. And I know a lot of you guys are passionate about mental health, and I think it's so important and so necessary going into the professions that we go in. For some reason, when you were talking about your role as an athlete and how many individuals you had surrounding you, making sure you were at your best, and it's a shame really that doesn't happen as much for doctors and dentists, where we are naturally responsible for making life and death decisions sometimes, and at the end of the day we just kind of go home and just have all that burden on us, not being able to talk to anyone. So I think the services that UK Doc provides are absolutely incredible. So thank you so much for sharing a lot of those. What I'll do is I'll ask you a couple of questions now, if that's all right, Dan, from the questions that have been submitted on the Instagram poll. That way, are you able to stay until a little bit later on when we do the big Q&A, or?
Yeah, I can do that.
Yeah, amazing. So I'll just ask you a couple now, and then we can do like a mixture as a panel afterwards with the other 3 doctors as well, if that's all right.
Perfect.
So what is it, in your opinion, do you think that kind of makes doctors and dentists hesitant from seeking support?
So I think it's an interesting question. So I think it's multifactorial. Essentially, the short answer is that I think that we are elevated in a position in society where we're there to look after each other. Our patients. And I think when we become the patient, that's quite difficult for doctors and dentists, I would imagine. I think that probably historically, our profession, not only within the NHS, but throughout the world, has been quite poor at coming and getting help. Like, how can a doctor have a drug problem or an alcohol problem? It's just not something that, has, I would imagine that that's something they feel they have to hide. And lastly, a lot of the services that are provided for doctors and dentists and nurses, etc., are in-house. And a lot of research shows that actually those services need to be out of house, away from their workplace, for them to go and feel comfortable to seek support.
Amazing, and that's exactly what UK Doc provides in a way, isn't it? With things like the huddle, for example, just gives you a safe environment for you to talk about your day-to-day things and anything that's bothering you. But I particularly love, even something as simple as just talking to your friends or your colleagues about anything that is affecting you. Just not many of us do it, unfortunately, and it's something that can be so useful as a first stepping stone. And then you can start, moving forward and do make most of the amazing services that are available. Another question is, so how do you go about your day-to-day in terms of your work and well-being?
Me?
I just want to know a bit more about you.
Yeah, so I try and exercise. Exercise is really important to me. I think there's part of me that is still, at least my brain still thinks I'm an athlete, although I'm 15 kilograms heavier than what I was when I was an athlete. So I have to, so for me, I exercise every day. I run and I do spin and I do some weights. Nutrition is quite important. I find that I'm not great with meal preps, but I've got a lot better. And I found when I was eating hospital food, etc., actually that really affected my mood and how I was and how I felt about myself, because in general, hospital food is not that great or not that healthy, weirdly. And the founding ambassadors that you see with the charity are Greg, Mark, Johnny, and Steph. They are my best friends, and we're just like any other group, but best friends. Like, we go out, we have fun, go on holidays together. But from time to time, I feel comfortable that I could talk to them about anything that I wanted, that I wanted to. if that was, thinking about leaving medicine, which I'm sure that we all do from time to time, or, from simple things about things that happen during the day. Although I'm the founder of a mental health charity, and mental health is a very big part of, I guess, my career, I think there's a balance that you can have where you don't want to go too overboard and like trying to do all these things. And I think if you're trying to do that, I spoke to someone last night actually, and they're like, oh, I'm doing yoga, I'm doing everything. And it's like, actually, you probably want to address what's going on underneath it, rather than keep on trying to add all these things or going for a run and make yourself feel better for an hour.
Amazing. Well, thank you very much. I think what we'll do now, Dan, if you're happy with that, we've got a couple of other guests who are just going to talk for the next about 30 to 40 minutes or so, and then we'll do a panel kind of Q&A if you're happy with that. So guys, for the rest of you guys, for the audience, I hope you enjoyed that very useful talk. And if you have any questions, pop them on the Instagram live, and then I will obviously look through those and then present them to the presenters. Dan, thank you so much again for this awesome talk. I'm just going to take your screen off so I can go ahead and share my screen. So if you just want to stop your share, and then I will go on to my one, and then we'll get the next guest up as well. Thank you. If you're at the top somewhere, I should say continue. Stop screen share. I can change it from here actually. There we go. Right, awesome. Guys, just to make you all aware as well, so if you text doctor in capital to 70970, you can donate £5 to UCAT and help the cause as well. Now, at the end of the day today as well, what we are going to be trying to do, once we talk about the personal statement, I'm going to give you some details about the Medic Life UCAT course. 70970 also gives you £5 off the UCAT course. So the plan is, I'll give you guys £5 off if you want to come along to the UCAT course. Hopefully you then go and donate that to UOK Doc. The Medic Life is also giving 10% of our profits from this month to UOK Doc, and then MDU have sponsored this event. All of that is also going to the charity. So hopefully at the end of all of this, we'll have a decent sum that we can present over to UOK Doc once June settles. We'll know the figures exactly, and then we'll go from there. So yeah, so if you text doctor to 70970, you can do that, and 70970 is also the discount code if you want to apply for the UCAT course. I'll give you the details again when I talk about UCAT later on. So yeah, thank you very much for that. Right, so our next guest, I'm very excited to have Dr. Melisa Padashi, who's done a few events for us before as well. Melisa is also very passionate about mental health. She is currently an orthodontics registrar in Bristol, knows a lot about teeth, a lot more than I do. So I know a lot of you guys in the audience today are prospective dentists, or some of you are dental students, some of you may even be dentists. So this is a talk kind of aiming at some of the challenges that you are likely to face in dentistry. And in some ways, because as dentists, you'll be working in much smaller teams than you do in hospitals. So in many ways, dentistry actually can be even more challenging when it comes to your mental health, and not being able to openly talk about it with your colleagues as much, because you are in smaller teams, for example. So Melisa, if you can go ahead and share your screen, please, and then we'll take it away from there.
Absolutely. Hello. I wonder if you can hear me and see me.
Yeah, we can hear you and see you.
Hi, everyone.
Thank you.
So I'm just going to share my screen. And if you let me know if you can see this.
Yeah, we can see it. All good. And do you want to put it into, yeah, amazing. Presenter mode is.
Yeah, so you can see that now.
Yeah, all good. Take it away.
Okay, lovely. So thank you, firstly, for having me. Just like you said in your introduction, I am very passionate about mental health and well-being. And it's something that I feel was not spoken about when I was at dental school. And it's something that I had to learn sort of on my own, as I worked as a dentist for a few years, my first few years of qualifying. And so I'm really grateful to be able to talk to you guys about this, so that you are well informed before you start your careers. So a little introduction, like Bakhtar said, I am an orthodontic specialist registrar based in Bristol. So this is a photo of me when I qualified, when I graduated from university, and I thought all my stresses and pressures were behind me. But I was wrong, because it was only the beginning. And like I said, I am passionate about health and well-being in general. And I also have a strong interest in supporting students through teaching and training. So what I want you to do is imagine yourself in the future. You've qualified And a few years into the future now, you have recently qualified and you're a dentist. And it's your first week in a new clinic. And you start your morning by looking at your clinic list and you think, okay, I've got 25 patients to see today. I know what to expect. And your first patient comes in and you say, good morning, sir, come on in. How can I help you today? And the first thing your patient tells you is, oh, I hate dentists, and no offense to you, but I hate coming to you people. And you maintain your composure, you take a deep breath and you ask your patient to take a seat and you say, oh no, I'm so sorry to hear that. Please do take a seat and let's have a chat, and you continue your consultation. And then I want you to imagine that your next patient comes in and they're crying and they're shaking from dental anxiety. And your patient tells you that she's too terrified to even sit in your chair. And she starts to open up to you about a traumatic experience she had as a child at the dentist, and how the thought of you even looking at her teeth makes her want to cry. And then you spend about 15 minutes just trying to reassure her, trying to soothe her nerves. And you're giving all the empathy you have, you're giving everything you've got, but nothing you do is helping her, and nothing you do is making her stop crying. You look at the clock and you realize you're already running late for your next appointment, and you start to become a little bit stressed. Then your next patient comes in and you're doing a filling on a tooth at the back of the mouth, on the top of the mouth, and you can hardly see anything. You're bending over sideways, you're bending your neck, you're bending your back, your patient has limited mouth opening, you can hardly see what you're doing, and you're starting to get cramp in your neck and shoulders already. Your receptionist comes in and tells you that the patients in the waiting area are getting angry because they're waiting, you're keeping them waiting, and you explain that you're sorry, you're running behind, and you'll be with them soon. Your patient in the chair says, I hope you're not going to rush my treatment. And you're reassuring them, trying to reassure the receptionist, trying to reassure your nurse. And then your next patient comes in and they're shouting as they walk through the door. I've had to take time out of work to come here and you've kept me waiting. This is unprofessional and I'm going to put in a complaint. I've now got a parking ticket on my car and that's because of you. And your next patient comes in and they've got a very complex treatment plan. So you need time to sit with them and explain the risks, the benefits, the alternative treatment options. This is not something you can rush. And you can't compromise on explaining all of the treatment options in depth with this patient. You also have to explain the difference between NHS treatments and private treatments and the difference in costs and fees that they'll have to pay. And you inform your patient that actually the treatment that they decide to go ahead with is not available under the NHS and they need to pay the private fee, and you quote them this private fee and they kick off. I'm not paying that, that's ridiculous, that's way out of my budget. And they start to argue with you about how much they want to pay. And you're looking at the clock. Your nurse starts sighing because she already knows that you'll be working well into your lunchtime. Your next patient comes in, it's a child, and they're crying because they haven't slept for 3 days and they've got a toothache that's been keeping them up all night long. Mum is stressed because her child is stressed. You're stressed because you're seeing them stressed. And as you start the procedure, every time you use your instruments, the child is raising their hands, covering their face, covering their mouth, and jumping around in the chair because they're scared of you even going close to their mouths. And you're thinking, how am I going to do this procedure? The entire time you're looking at the clock, you're really late. Then your next patient comes in, hey doc, the crown you fitted yesterday has fallen off. Your work is pretty shoddy, don't you think? How do those interactions make you feel? You look at the clock and by now it's only 11 a.m. in the morning and you have the rest of the day to go. Let that just sink in for a minute. And how does that make you feel? Do these interactions make you feel unvalued? Do they make you feel stressed? Under pressure? Physically tired? Mentally tired? And now I just want to tell you and make you imagine that these interactions will happen pretty much every day. And dentistry is such a unique healthcare profession for that reason alone, because you're caring for people, you're managing anxieties day to day, you're also doing a manual skill that's physically challenging on your neck, your back, your shoulders. You're also charging people money for what you're doing. And like Bakhtar said as well, you're in a small clinic room on your own with a nurse. So it's isolating as well. You're a businessman or a businesswoman as well as a healthcare professional, because you have targets to reach. And your boss is also on your back, making sure that you're charging the right amounts and seeing enough patients to make ends meet for the practice. So I want you to ask yourself, if dentistry is something that you're interested in, how will you prepare yourself to be resilient in such an environment where expectations are high, people are generally not excited to see you, they generally walk in telling you they hate seeing the dentist, and in an environment where the subject of money is thrown into the mix as well? How will you prevent yourself from burning out? And essentially burnout, this feeling of emotional, mental, and physical exhaustion, it's grounded in pressure. There's an emotional pressure, which is what we have to do is dealing with anxious patients on a day-to-day basis as dentists. There's a cognitive pressure, having to decide the correct treatment, the correct procedure for somebody, especially with all the information online that people read before they come to an appointment. So they come to an appointment knowing what they want, which is not necessarily what you think is right for them. There's also physical pressure, the difficult postures we have to sit in when we treat our patients. And then there's also quantitative pressures, the time allocated for each patient. You've constantly got your eye on the clock, the rush against the clock and charging people money for your service. So the consequences of high stress at work, the evidence suggests that in dentistry, there are negative consequences such as increased risk of burnout, illness, sick leave, early retirement, low job satisfaction and work engagement, and also consequently poor performance, clinical practice, and patient care. So it's needless to say that we don't want to be in a position where any of these factors are a part of our lives. A study of UK dentists carried out by the British Dental Association found several mental health issues that were raised within these dental participants, and they highlighted the following issues as those that contributed to their burnout and mental health issues. And they said stress at work, they said the anxiety they have to deal with on a day-to-day basis, they felt depressed, they said that working conditions were difficult, they said that patient expectations were too high, they said that they have increased admin that makes them stay behind at work, stay late, not have time to rest. They felt that there were too many financial pressures they had to deal with. They couldn't focus on healthcare and the caring aspect of the job, which is the reason why they went into healthcare. They felt that they had to be business-minded, which is not necessarily something they had anticipated. They found the work contracts were demanding. It was all money-based and numbers-based, making it really difficult to find that balance between patient care and making money, because you're not on a salary as a dentist, you're self-employed, and so you have to make the money that way. And they also reported a lack of gratitude from patients, which affected their mental health. And they also mentioned that they felt that their perfectionist nature contributed to mental health issues at work as well. So furthermore, in this study of UK dentists, they found that the highest risk factors in dentistry that contributed to mental health issues, number one was fear of the regulators and the regulations that they were under. They felt that they were very strict and that at any point a patient is able to make a complaint and take them to court. And that fear is something that induces a lot of anxiety. The patient expectations, like I mentioned, financial pressures, and also the stigma of asking for help, because like it was mentioned in the previous talk, often people in healthcare don't feel comfortable to ask for help, or they feel as though they should hide the way that they're feeling. And then there are other pressures. If you're not working in a clinic setting in a dental clinic, you may wish to apply for specialist training and work in a hospital environment where you are working in a bigger team and you do have more people around you. And so that may be a nicer environment to work in so that you're not as isolated, but it comes with its own pressures. So in order to be able to apply, there are pressures such as having to apply for conferences and writing essays and writing publications, writing presentations, carrying out audits, quality improvement projects, getting involved in research, trying to win prizes, and it's incredibly competitive. So what I would urge you to do is tap into that huge body of evidence that we have at our fingertips right now regarding holistic health and well-being. The research tells us that nutrition is important, sleep is important, movement is important, exercise and rest is important. So it sounds obvious, but these lifestyle factors are factors that I think can be really easily overlooked or brushed to the side when we're busy with work. Oh, I'm just busy. I've just got a long day. Oh, I'll do it tomorrow. I'll do it tomorrow. I'll look after myself tomorrow. But actually, sometimes tomorrow is too late. And interestingly, I do think that currently with lockdown, a lot of people have started thinking about these things. People have had more time on their hands. They've started looking after themselves a little bit more. But it's important that when we go back to full-time speed of life, the way it used to be, and everything picks up again, that we hold on to these pillars of health. So what I would recommend that you do, and what I try to do, but I don't always do well, is schedule specific time every day for these aspects of your health. Time for your mind, time for your body, and time for your soul. So for your mind, for example, being out in nature, spending time on your own, jotting down your thoughts. Maybe you like to practice mindfulness or meditation. For your body, exercise, move, use your body, stretching, yoga, weight training, running, whatever works for you. And for your soul, maybe quality time with a loved one, or schedule some time in for passions that you forgot you had, like painting or baking or playing an instrument, for example. If these things are ingrained in your daily routines, I really believe that when your work schedule gets heavy and when pressures and stresses at work come your way, you're less likely to compromise these factors that strengthen your resilience. And I really can't stress the importance of reflection enough. My advice to you would be to reflect on the balance of your life, reflect constantly, and create and schedule these non-negotiable times in your day, times in your week, where you focus on your well-being and your health. Because if you're not healthy, it will impact your colleagues, it will impact your patients, it will have a ripple effect in your life in many aspects. And I don't mean to put a downer on dentistry. I absolutely love the profession. I love what I do. None of this is intended to put you off or make you feel bad or negative. But I really think it's just important to just give you this insight before you embark on this career, because a lot of us, my friends, my colleagues, we didn't know this stuff. And we just had to experience the stresses and not have the tools around us to manage those stresses. I urge you to take your well-being and your resilience and your self-care practices seriously from now, so that when you have your first day in clinic, your first week in clinic, and you have those sorts of experiences that I mentioned at the start of my presentation, they don't even faze you. And thank you for listening.
Amazing stuff. Thank you so much, Melisa, for this awesome talk again. You know, I think I've definitely picked the right guest speakers today for this mental health oriented talk. But yeah, I'd never even imagined how stressful being a dentist could be. Of course, you know, we were all aware that dentistry is a high stress job. But hearing from you when you just kind of portray what kind of patients you get and things like that, it just sounds, you know, obvious how much more stress dentists are under than medics alone. I know you have to go. I know you have to shoot off in just a minute or two. I've got a very quick question from Instagram. How does the fact that, you know, treatment is not always free in dentistry as opposed to as a doctor, you know, at least I know my patients are not paying a check to the hospital. How does that affect how you feel about the jobs that you're doing?
I think for me personally, and from speaking to a lot of my friends, I think that's one of the biggest stresses about the job, because there's this conflict within you where you want to be a healthcare professional and you want to help your patient and care for your patient. But then once you have that conversation, you ask them for money, and it's this bizarre conflict that you have to manage. And then there's always a reaction as well, that a patient is maybe not happy with that price that you've put on a treatment you're going to do for them. And it's about managing the expectation that the patient has, and it's about managing your worth as well. So all of those factors put together, it does create a lot of pressure in that sense. But at the end of the day, for people who are going into that profession, I would just remind you that, you know, as a doctor, you're getting paid for what you're doing in a hospital. The patient's not paying you right there and then, but you're getting paid for what you're doing. So you just have to remind yourself that as a dentist, you're getting paid in the same way, but you're seeing the patient physically give you the money, if that makes sense.
Of course.
Yeah.
But yeah, thank you so much again for your talk. I'll let you go because I know you need to go away, but thank you so much for this amazing talk. I'm sure everyone's absolutely loved it. Yeah. And we look forward to having you in future events as well. So yeah, thank you again.
Very much.
And enjoy your lovely day.
All right,
guys. So
bye.
Bye. Right, guys. So I hope you guys enjoyed that as well. We have got our next speakers. We are running bang on time as well. This is great, you know, organization to the max. So we've got our next two speakers who are twins. They're Dr. Sunmeet Kandhari and Dr. Navneet Kandhari. So about 11 years or so ago, I met these guys on my first day of sixth form at my new sixth form college. And coincidentally, we got put into this icebreaker circle, all three of us with other people as well. And, you know, the icebreaker question standard, as you can imagine, when you're starting A-levels, is what do you want to do at uni, for example. And I remember these guys saying like, oh, we want to go into medicine. And my 16-year-old self, you know, in that competitive mode was like, aha, I've got my competition now. Little did I know, had they asked us the question about where do you see yourself in 10 years, we'd be talking about working as a team, helping prospective medics and dentists as qualified professionals. So Dr. Navneet Kandhari is an emergency medicine foundation year 2 doctor, so same stage as I am, at St. George's Hospital. And he's gone through all the different rotations in another hospital as well. And he's hoping to, hopefully, depending on what happens with COVID, go to Australia to do a year out there and get some experience. Dr. Sunmeet Kandhari is a dentist who works in a restorative dentistry in Birmingham. Sometimes also does weekends in London as an associate dentist. And just when you thought, you know, he does too many things, he's also part of the Army Reserves as well. So he's got his fingers in loads of different pies in the dentistry world. So welcome, guys, to the event. I will let you guys share your screen so we can see you guys. But yeah, go ahead and share your screen, and then we will take it away with your presentation.
Cool. Good morning. Yeah, morning, everyone. Thank you for the warm introduction back. Yeah. Has anyone introduced you, by the way? Because you've talked a lot about your school experiences. I feel like we should. Yeah. You guys can do it if you like. Yes, I've never heard you talk about me so formally. I don't think you've ever said I'm a doctor before. That must be a sting for you. The only reason we come along to do these talks is because this is the nicest things that Bakhtar ever says about us. So yeah. If we're sharing stories, all we were friends with Bakhtar for with his mom's chicken wraps. Oh, yeah. But anyway, right. So just roughly back to, just so I know, so we're aiming to finish when? 11:20, half
you guys have about 25 minutes or so, but yeah, we're okay for time. So yeah. So
that's okay. Fine. Yeah. So to introduce myself again really quickly. So my name's Son, and I'm going to be touching on the dental aspects of well-being and mental health. And Nav's going to be touching on the medical aspects of well-being, mental health. And I know this is within the umbrella of you getting lots of talks today. And Melisa, thankfully, has done a lot of the dental heavy lifting for me already, so I can sit back and relax. Not really. But yeah, so the next 15, 20 minutes or so, we'll talk about who we are, our journeys, and how we got here, because I think that's important to know where the advice is coming from or where this information is coming from. Nav will touch on the medical aspects, I'll touch on the dental aspects, and we'll finish up again with some well-being at the end. for those of you who have maybe seen bits of this talk before, specifically on the work experience parts, there are some elements of that as well, but we're going to just try and flavor in some more well-being bits as well. So I was a graduate from Newcastle up north, and that's where I did my medicine degree. Now, as Bakhtar said, I'm doing my FY2 year, my second year as a doctor down in Southwest London, and currently working in A&E. And then outside of that, I do some volunteer work for a couple of other organizations, which, you know, a lot of people tend to do in their spare time. And then, yeah, so I graduated from King's a few years ago. And right now I'm working in Birmingham Dental Hospital as a hospital dentist. I also work in practice as an associate, which is probably what you guys think of when you think of a dentist. So a GDP is what it's called, and we'll touch more on that later. And on top of that, I do some stuff for the Army Reserves because I have no friends, so work is my friend. So, yeah, but that's a good point to touch on. As you can see already in terms of where we're at, Sun has a lot of flexibility with how he wants with his career, and we'll talk about that in terms of well-being later on. And then, yeah, do some stuff with other organizations just like Nav does, and it's always important to have some other extracurricular activities, and these jokes have been rehashed and recycled many, many times. So we like recycling jokes. Good for the environment. Absolutely. That is also a recycled joke too. So yeah. Anyway, so let me talk about the medical side of things. I'll tell you about my day-to-day life as a doctor. Briefly though, as soon as you graduate, you do your 2 foundation years. So I'm in the second year, FY2. You then embark on a training program, depending on what you want to do, or you can take a year out before you decide to take that leap, which is what I'm doing. And hopefully going down under, can't really do the accent, but you got a year. It'll improve when I'm out there. By the way, sorry if we're going through a whistle-stop tour of all of these things, but don't think work experience is the focus of today. So we're kind of, but you know, if you do have questions about that, we can save it for the end. So this is a very rough general template of a day-to-day day shift on the wards in hospital. There are differences between medicine, surgery, whatever rotations you do, but essentially you come in the morning and you prepare the list of patients that are on your ward. Then you go on the ward round with all of your senior colleagues, and then you create a list of jobs depending on what that review of the patient had. So bed 11 needs some bloods, bed 12 need to refer to cardiology for their opinion, etc. Once you've seen everybody, you make a big list of all the jobs and split them between all of you. And then in an ideal world, you go off somewhere as a team to maybe have lunch, or you might do training that's like scheduled every so often. And then you might come back after that to finish those jobs. At the end of the day, you're wrapping up, seeing any unwell patients, and then handing over to the on-call team anything that needs actioning overnight. And then big air quotes, and you're going home at 5. Okay. Doesn't happen all the time. Probably can count on your hand the number of times it's actually happened, to be honest. But yeah, that's the goal. Outside of your normal day shift, you have on-calls, and there are different flavors of that. One could be, so when patients come into A&E and then decided that, oh, these people are unwell enough that need admission, you might be seeing people on the take list. And basically that means you're going to be seeing people with medical or surgical issues pertaining to whatever specialty you're working in, and you clerk them in, try and give them treatment, etc. That is a bit more than what A&E may or may not have done. This is a screenshot from the first wave of COVID, and obviously you can tell there's a lot of COVID. And at the bottom, nicely put, pardon the pun, you can also see some other interesting presenting complaints like that people were coming in with in the first wave. Big fan of that. I can't tell you exactly what happened with that gentleman, or obviously serious enough that they came in through a pandemic. Yes, man. Yeah, definitely. Yeah. Outside of that, you might also be covering the wards. And so this interim F1 is holding a bleep, and a bleep is something that the wards contact you on to try and highlight, hey, we have an issue. Can you come and help give us some advice or help us out? Medicine is a weird and wonderful thing. You don't really know what to expect. On call it's a weird bag. So I remember seeing this in one of the patient's notes and I thought, wow, what a detailed history, but also thinking that I probably had to refer to someone like Sun to give some expert advice on 4 liters of Coke. You know what I love? It's like approximately 4 liters of Coke. Like there's a threshold, like, 2's okay, but 4, that's an emergency, So in terms of the other things outside of actual medical work, there's lots of things to do. You can get involved in teaching, research, other like leadership activities. The world is someone's oyster, including yours. Ooh, put that on the board. Yeah. Right. So yeah, I'm going to touch on the dental bits now. Don't be alarmed. We didn't do actually any treatment on the sloth. It's just a nice picture. When I was on my elective, it just washed up on board and we rehoused them. But yeah, so story for another time. And as Nav was saying, you know, whistle stop store, so 5-year degree for dentistry, and after that you do a year, or most people do a year out in practice. A little bit of a difference from medicine, the fact that when you qualify, you are way more independent, I would say, than when you're a medic, because when you're an F1, F2, you still always present all the cases, you work in a larger team. Whereas when you come out as a dentist, you are, I would say, 80% good to go to start working by yourself. So that's what that year is, to really get you ready to up to grips with NHS dentistry. And then after that, you can go down one of two paths. Most people end up going down the associate route as a GDP, and as well as doing further training in hospital as a DCT. And then if you stay at that for a couple of years, maybe you even want to go into specialty training. And I know Melissa already talked about that at length, so I'm just going to park it there. So because I do both as an associate and hospital stuff, I'll talk a little bit about both the roles. So as an associate, you are the face. And again, this is what most of you will associate as a dentist. And it's like your GP equivalent, your GDP, so general dental practitioner. So of that patient's journey, of that dental milestone, you are the first port of call. Within that, there is a minimal hierarchy in the fact that you are owning their treatment. You make the treatment plan, you carry out the treatment plan. Obviously, if there are things that are quite complicated, then you can refer to the hospital and specialist services, which are there. But often you're working with yourself and the patient together. Within that, that gives you a lot of clinical freedom to do the things that you may like to do with resources and time availability. But, you know, you can have quite some nice cases. This is a really simple one, just did a bit of whitening and then a small white filling to help bridge up the gap and really improve the aesthetics. And then, like I said, you know, you have that flexibility. The reasons why I could do all of those things with the Army Practice Hospital is because you're self-employed, as it were. So if I wanted to, I could work 3 days a week, but that is a really long shift from 8 in the morning and it ends at 9 in the evening. If my practice was willing to do that, it's more onus is on me rather than sticking to a hospital rota. Also easy to take off time off work. I've seen him have to do it. It's a nightmare. Variety, because you can do lots of different kinds of treatment. I'll show you a typical list in a minute. And then it's very practical, very hands-on. So if you like your hands-on stuff, and I was tossing up between being a medical surgeon or a dental surgeon, dentistry was the winner for me because I really like that hands-on element. And yeah, so here's a typical list. End up coming in a little bit early so I can plan my day ahead. And that's, you know, some emergencies and some new patient stuff, some teeth taken out, all wholesome stuff. Lunch, if I do get it, is usually never really an hour. It's always writing out notes or referral letters. And then round 2 in the afternoon, dental boogaloo. And then if I'm lucky enough, finish at 5, often a little bit later. But I think I usually fare nicer than Nav in terms of getting out on time.
It's not a competition, but yeah, if it was, he definitely wins.
But obviously COVID has changed the landscape a little bit, and I'll touch on that in a moment. But now here is what a list would probably look like because of aerosols, fallow time, of which I will explain later. And yeah, I know Melissa went about this at length. So what a dentist does in hospital, essentially it's an opportunity to work in hospital as a dentist. And sometimes you can feel a little bit like an F1. I think it's a sticking point for Bakhtar and Nav because I was basically doing their job as a medic with 2 days of training, which is, tough on them.
But then there was this time when the son got bleeped asking about, you know,
it was my first day, man.
Can you prescribe some fluids? And this guy was thinking, oh, what do you mean?
Like,
water?
Yeah. I've seen one house episode, so I was like, oh, yeah. Hartman's. I've heard that word before. Yeah.
Those are like IV fluids, intravenous fluids, which, so you get down the 3rd day.
Yeah. So I missed
You should have stuck it out.
Yeah. But anyway, yeah. So as opposed to GDP, now you have the hospital hierarchy again, registrars, consultants, you present the complex cases. And then the upside of that is that you develop some extra skills, things that you wouldn't have done necessarily in practice. So the good, the bad, and the ugly. So I think, and if we talk about stresses, there's a lot of overlap between both of ours. But if I can speak briefly for my one, and we'll take it in turns, the workload of a lot of healthcare practitioners has increased dramatically over the last few years. Many different reasons for that. One of which is people are just living longer, okay? And the more you live, the more likely you are to pick up other diseases, which means that the kind of care that we give people is more complex. Also, with all the research that goes on in medicine and dentistry, we can do more. So in terms of the benchmark and how good care we need to provide, that gets higher. And on top of that, population's increasing and there's not necessarily enough staff to fulfill or bridge that ever widening gap. So we just have more stuff to do with the equipment that we already have without actually having more people or staff and resources. And that makes it harder to achieve. I mean, in terms of like people aging, they say the person who's 120 is already alive today. It will probably not be me. But it's the same thing with dentistry. You know, you're having people who are living a lot longer and they have way more comorbidities, a lot of medications, a lot more things that complicate their treatment. So it's not just the mouth anymore. You're thinking everything else. You know, do they have mobility issues? Can you recline them in the chair? You know, my oldest patients, they need dentures, which can be difficult to make. Then you look at the next generation, they have a different set of needs. And you look at our generation, heavy focus on aesthetics. So there's many, many different pressures, more pressures on a more demanding population. So these things in isolation are maybe manageable, but when you factor in other things like time pressures, that makes it even more stressful. So to give an instance, now being an A&E, I'm sure many of you will know, or you'll know now, that we have a 4-hour time in order from the patients arriving, getting triaged by the nurses, and then us deciding, are they going to go home? Are they going to, have we finished their treatment, or are they going to get admitted? So you have 4 hours to do that. And we have more people coming through the door. It takes longer and longer for the medical team to go and see them. And when there's a lot of people, you know, all of these external pressures being like, you have to see this person, you have to make this time. When you're rushed to make decisions, often with less time, it means that you might make mistakes, and that just increases the stress that's involved in the process. And it's a difficult thing as well, because obviously you want to know, like, how can you measure good performance, like good healthcare outcomes? And usually people refer to stats, but you know, humans aren't tick box exercises. And so when you're given these time pressures to try and fix problems, it's not easy. And as I was touching on before about, you know, time and things like that. So I mentioned something called fallow and AGPs. Essentially what happens, and this is as a result of the COVID pandemic, is if you do anything that generates an air spray, so an aerosol, what you need to do is wait for all that dust or those air particles to settle. And that's called the fallow time. So with dentistry, we use a lot of turbines when we cut teeth and things like that. So now, before, when you could go back to back with fillings, emergencies, now if I have to drill or cut a tooth, I then have to wait at least minimum 20 minutes before I can get another patient in and clean. So that obviously compounds your ability to be a bit more flexible, do more emergencies, see more patients. And it's the same thing when I was working in a surgical ward in Max. Again, when we're doing treatment in theatre that generates aerosols, cutting and things like that, we have to factor that into our operating times. Same thing in surgery in hospital as well. So touching on making decisions under a lot of pressure, responsibility is another thing that a lot of healthcare practitioners bear on their shoulders. Just the fact that you're responsible for a lot of these people, and health is wealth, as they say. So if you make a mistake, it might mean nothing, but it could mean a lot to that person and that person's friends and family, and that's a lot to bear sometimes. Yeah, when things go wrong, my patients lose a tooth. It cuts me out. I'm making like, it's especially in things in medicine, humans make mistakes, and sometimes it can have really devastating consequences. So it's a lot of responsibility to bear. Well, I was just going to say, something that I've come to terms with over time, and I'm still very, very early on in my career, is that making a mistake is inevitable. You always hope that your first one does not amount to much. I know some of my colleagues it has done, and there's always learning to come from that, but it's something that we all carry with us whenever we're seeing the person in front of us, dental, medic, surgeon, but that's a big one, definitely. And I know that Melisa talked already about big words like burnout and stuff, and I put some keywords at the bottom. Obviously you can tell in Wellbeing talks a lot of these themes are similar. I'm not sure if imposter syndrome is something that's come up, but briefly, that's when you feel like you're an imposter in your own skin. You're not qualified to be here, regardless of how well expertise or qualified you are. A lot of people, friends, family in this profession have that. They feel as though they don't have the right necessarily expertise to be where they are. And to put into perspective for you guys, that person is someone who goes into the exams, normally always aces it, but they leave that exam being like, oh, I totally failed that exam. they don't have that self-confidence in themselves necessarily. And it's very easy for us to be like, oh, you'll be fine. But that fear can be really true and realized to that person and be quite difficult to manage.
I get it sometimes. You know?
Definitely.
And touching on, I guess, the responsibility bit is when you're a dentist, as it were, you being the face often means that you don't have that wealth of senior expertise right at your doorstep when you're in hospital. So that has that added aspect of stress where, you know, how am I going to deal with this? I remember when I was in my training year, I was the only dentist in practice, and this old lady, bless her, she'd literally just fallen on the step outside on the curb, and just smashed all her front teeth, and it was just a walk-in. And I was like, what do I do here? This is so crazy. But yeah, it was stressful, but we got there.
The last thing I want to talk about is something that people don't as blatantly mention about stress. And it's not necessarily related to work in hours. It's more about the things that people don't mention that you have to do in your own spare free time in order to progress in your career. So for instance, in medicine, if you wanted to become a consultant in medicine, you would have to sit exams, quite difficult, but you'd have to study for them in your own time.
At your own cost as well.
At your own cost as well. So if you failed, you have to pay for that retake. And those exams are very costly. They go into the hundreds, even thousands sometimes of pounds. Put exams aside, you have portfolio targets that you need to meet. You have courses that you might need to go on. And if you want to get a competitive specialty, you're competing against really distinguished individuals. And there's a lot of career pressure to do all these things in your spare time. So not only is your work can be stressful at some days, you also have to go home and think about this stuff in your free time. And it's hard to switch off, and it can be quite difficult.
Yeah, I think a common thing is to think, oh, once I get into medicine or dentistry, that's it, you know, I'm done. But actually, you know, the rat race is just beginning, to be honest. And it's only something that I'm starting to realize a little bit more now. But doing these careers, they're 5 years long. They can be quite laborious. So often, sometimes you put the rest of your life on hold. Where, as I compare that to my friends who went to corporate fields or things like that, did something a little bit different. You know, they're alwaady looking to settle down, have houses and things like that. Whereas when I look at most of my medic and dental friends, they're only starting to get to there now. And the last bit I'll say is there was also, you're working for the NHS, taxpayer funded, so it's very different. You know, you don't really get a company phone, a company car or things like that. You know, you have to pay for your own courses out of your own pocket. I remember the biggest talk amongst town was when we were on a study, they gave us free chicken goujons, and then we were all like, oh my God, this is amazing. Greatest thing that's ever happened in my life. But again, that's just one thing, an element. So if you're all about the money, having the corporate perks and stuff, then maybe think carefully about medicine and dentistry.
Obviously, we've just like slated our own careers. Don't worry, we will talk about why we're still here, why we love what we do. But just before we do that, if you guys are applying, I think it's fair game for them to ask you, how has COVID impacted the landscape? Or what have you done in these times?
I've sat on a couple of interview panels this year, and we definitely asked questions akin to, how has COVID impacted either medicine or dentistry, what you're applying for, or how have COVID impacted you? What have you done during COVID? So at least have that answer in your back pocket.
So I just want to briefly touch on, with such a wide question like that, it's good to have a systematic, structured approach. So a biopsychosocial approach to answering what the impact of COVID on the healthcare environment is useful. The biological stuff is self-explanatory in terms of the actual physical symptoms of infection, but long COVID is also something that's well documented and can mean that they're not able to complete their normal activities of living because of the physical health symptoms that they have. But the psychological stuff that a lot of healthcare professionals faced were being in unfamiliar situations, being redeployed, coming back home and fearing that they might infect loved ones. And especially if you're involved in one-to-one care with a lot of really sick COVID patients and having difficult communications and conversations with families every day, often over the phone about how their loved ones are dying and they can't see them. There's there's a lot of evidence out there to say that a lot of frontline workers have dealt with PTSD or post-traumatic stress disorder just from that. And that's obviously an important point to bear. And on top of all that extra stress that happened during the first few waves, we were less able to use our social networks and vent and speak to people in the same way, you know, face-to-face rather than virtual, which just compounds all of that stress.
And then I guess if you want to go even more broad spectrum answer, you can then talk about your wider aspects on effects on all industries, basically materials, supplies, something that we've struggled in the hospital, getting impression trays. I mean, part of that is Brexit as well, but certainly COVID hasn't made things easier. But anyway, so bashing our professions is over to the good and why we're still here. At the end of the day, you're in a human-centered career. You know, it's very much on fixing people's problems, as it were. So you're in a very unique, privileged position. There are many times when I have patients come see me and yeah, I might be a carpenter of the mouth or a microsurgeon, but also then I become a therapist and I'm helping deal with them in that aspect. And patients sometimes overshare, as it were. So it's a very unique position that you're in, but for the same reasons, it's very rewarding because you can make a difference. And often there are times when you can see that difference and how it really changes someone's life. And you know, for all the times when you have those good bits, it also challenges you, it pushes you. So I'm always constantly thinking about how to solve this problem. And that's one of the reasons why it's also really, really rewarding. And again, not a major plus point, but it is a really good point to bear in mind is you have good job security. People are always going to need a dentist or a doctor. When I was coming at the end of my 5 years, I had a pretty good certainty that I was going to have a job at the end of it. Whereas if you compare to other professions, you know, law and things like that, history, geography, you don't always know you're going to have to apply to jobs and things like that. But for me, I knew it was pretty much a done deal. A lot of the things that Sun touched on, I basically agree. So the only thing that I would say keeps me coming back to the profession, or the main one, is satisfaction and reward. And it's the human things of my job that keep me in it. And I remember one example of how I was in A&E. It was a quite stressful shift. It was like the second to last day of Ramadan. And there was this daughter of a quite elderly mother who had come in. She had dementia. She was very, very confused. And the daughter didn't want to leave her bedside and hadn't been able to break her fast. And I was just like, you can often in medicine, you can just think about people as numbers. And it's difficult to try and, when you're under so much workload, stress and pressures, to not think of the person as just the person in bed 11. Just remember they have a friend, they have a family, they're a wife, daughter, mother, sister, etc. And I think the best thing I did for them was not necessarily treat their mother or something, but it was to run to the nearby M&S that was just about to shut to get some medjool dates. If you haven't had them, amazing, bro. Just so she could break her fast for iftar. And that, of all of the medical expertise, the 5 years I spent, it's those human moments that I really take and value. And that's definitely what she appreciated more than anything that I had to say. Also because he got M&S finest as well.
Yeah.
Yeah.
But yeah, so it's satisfaction is the reason I think we keep coming back. And it's such a rewarding job. The last thing, and I know we're probably going to run slightly over, so Bakhtar, do cut us off or text us if you need us to stop.
You guys are all good. Carry on.
Thank you. So supportive. What would such good
Never
support
seen
for well-being.
Wow, good
Love
well-being back to, yeah.
Jokes aside, all of you guys, if you're prospective students, or you're thinking about it, or you're just kind of here out of interest, this is a really stressful moment in your life. It might even be the most stressful period in your life so far. I certainly know it was for me. And a lot of people build this moment up to pre-uni applications to be like, if you don't make it, this is it. Your entire life is about this moment, and that's just not true.
All right,
whatsoever.
Yeah.
Or you say, all right,
I was like, oh yeah, that's like directed by Michael Bay. Just have some explosions in the background,
that would help.
Yeah.
So I just wanted to share some perspective on that, a different way of thinking about the situation that you're in, and maybe we can use this as a springboard to talk about our own experiences. So the first one, I would say, this is going to be daunting, but you have to try. You'll learn a lot from doing it in the process, and you'll never know if you don't. So I have a lot of people that sometimes they might come back to medicine or dentistry having felt that there were things in their way to stop them from applying. And it's not necessarily a regret, because I guess they went back to it, but certainly you'll never know if you don't give it a shot.
You miss all the shots you don't take. Wayne Gretzky, Michael Scott. And the thing is, every single time this slide comes up, it always makes me laugh, because this is Nav who wrote this. And I don't know if you can tell, but often I think that's a biscuit rather than a moon, but he wasn't afraid to try.
No,
so yeah,
I think it's more of a donut that's aerated. But anyway, don't be afraid to try. Okay. Yeah. The second one, no matter how you slice this situation, it's going to suck. Okay. It's going to be hard. It's going to be difficult, but you have to ask yourself whether or not is everything that you're doing right now preparing you for what you've asked for. And what that is a career in something that's quite challenging and quite difficult. That's not even something to say about medicine and dentistry. A lot of things in life are difficult, but if you can find the time and muster the courage to get through that now, it'll give you way more motivation and, I guess, the feeling
of that resilience.
Yeah, deservingness, for lack of a better word, for when you get there.
And the last one, very difficult to do. I really struggled with this, but you have to think about the things that you can control and focus on those. Because once things are done and they're out of your remit, you can't change that. So, you know, if you've got your UCAT results, maybe you didn't score as well as you did, fine, that's neither here nor there. But you can focus on researching which unis don't take that into account as much. Or you can focus on your interview technique. Or in fact, you can go on courses or workshops, just as you've done here, which is the right thing to do to help better your chances and give you more information. Those are things you can control, and those are things you should act on. The last one, I'll hand over to Sun to talk about, because I guess he's got more experience and relevance to this.
So I think it's an interesting thing whenever people ask people who are medics and dentists what their journey was, because it's always slightly different. And exactly as this quote says, is you will get there, but right now you're here, and that's great. Not everything goes to plan every single time you want it. The phrase is no plan survives contact with the enemy. Not saying that applying to medicine dentistry is the enemy, but so to tell you about my experience, I wasn't successful, got straight up 4 rejections. And then I had this moment of, you know, I got that knock. What do I want to do here? Really reflecting that, you know, dentistry is still something I absolutely want to do. And then reapplied, and I got in. And I think going through that whole experience actually made me a better person. And when I look across all of my friends who've had similar knocks, whether it's pre-application not getting in, or even post-application, they're studying, they fail an exam and may almost lose out what they're trying to embark on, always makes them better. And it's, you know, learning from when things don't go right, and failure makes the best. If failure is the best teacher, will also make you better. So whatever you're going through right now, if it doesn't go right first time, that doesn't mean it's the end. And speaking from my experience of being on as an interviewer, a very weird scenario I found myself in, or have found myself in, is that I realized that actually the interview was never out to get me, or at least I never was. What I'm doing there is I'm sitting there and I'm looking at you and I'm asking you these questions and seeing whether or not I actually believe this person knows what they're about to embark on, and whether or not I think they're going to enjoy it and they want to do it. Because it is a lifelong commitment by and large, and I want to make sure that this is the right person. So of the times when I said no, it also didn't mean no forever. It just meant no for right now, which is exactly what happened to me. But I came back with more enthusiasm, more zeal, and then I got in. And generally speaking, I think it's also important to remember that what you're about to do is a marathon. It's not a sprint. So don't compare yourself to everybody else in your group. Be like, oh, they got in, I didn't, blah, blah, blah. It doesn't matter, because you are running your own race, and it's important to do things at your own pace. Wow, that rhymed. Nice. And you can walk it, but you have to run that's it. Fine. So that's, There was a guy, I remember when I was applying, his shining story was he applied 7 times to get into medicine. So I think at that point, you maybe need to have a critical look at what's going wrong here, but he got in. So, and he was happier for it. Yeah. So I know we've talked about a lot. The only thing I just want to briefly finish on before we open up for questions, just to say that me and Sun are not, you know, overly distinguished like professionals in sort of well-being or mental health. We're just 2 guys who like to support people around us. We've just kind of made our own journeys and make it up as we go along. And while it might sound like a lot of people here that have spoken to you today, they might seem quite, you know, at the far end. I'm not sure how I could see myself in them shoes. Where you guys are right now, me and Sun were very much there, however so many years ago. And what I'm going to say is don't think of us as any way different from you. We're just 2 guys trying to make things up as we go along, like, and help people as we go there. And we haven't really talked about well-being, things that you can do in the meantime. I know Melisa already did, but if there are questions about what we do or what things you can do, I'm sure we can signpost you to some resources if that helps. But thank you very much for your time. And I think we'll finish well over time there. 4.
You guys did pretty well in terms of timing as well. And as always, it's really nice to have you guys just lighten the mood as well and just give some really awesome advice from both of you guys. So yeah, no, amazing stuff. Thanks very much, guys, for making time.
Shall I stop sharing?
Yes, please, if you can. I think Nav, you've got a shift tonight, haven't you? And then yeah, so I know you guys are super busy as well, so thank you so much for taking your time out. What we'll do, guys, is let's just take about 5-10 minutes to do a Q&A. We'll get Dan to come on screen as well if possible, and I've written down some of the questions old school on a piece of paper. So we've got questions for our panelists. I know Melisa had to go because she's got other commitments as well today. This is the life of working professionals in the healthcare. Unfortunately, you always balancing with your time. But yeah, we've had amazing talks from all four of our guests. You know, Dan, thank you so much for taking time out and telling us about the charity. And I'm just amazed at how many different services are out there. And then obviously Melisa talking us through the challenges in dentistry, and then Sun and Nav, you guys talking us through some of the challenges as a junior professional in our prospective careers. So the first question is for Sun. So people are asking, obviously, there's a lot of interest in the army role that you have. So what's your role in the army, and does that add to your stresses, or does it kind of help you take away because it's something different from working in the hospital environment, for example?
Okay, so essentially the Army Reserve is basically what people used to call the TA, so it's Territorial Army. So it's essentially, how would I put it? So I'm not really there for my clinical role, but it's more like officer stuff. So it's more about training, deploying on weekends. So a couple of weekends ago, me and 254 MedReg, based in Leicester, went up into a field and basically set up a pre-hospital care setting. So on a front line, if you have contact with the enemy, you're expected to take casualties. So it's basically getting patients back on that pathway. And either it's you send them, turf them back to England if it's a really severe trauma, or to a field hospital, or you can patch them back up and send them right there. Now, I'm not going to take up the whole 5 minutes. It's a whole nother talk entirely, but essentially I want to do something a little bit different. The army was challenging and it is stressful, but they also do reward you for that, and they give you the training and things like that to get there. So it definitely gives flavor to my clinical role as a dentist.
Amazing stuff. Thank you very much. So next question is for you, Nav. So you mentioned very briefly in terms of like making mistakes, and you know, as humans, we all make mistakes, and as doctors and dentists, we do as well. How does that mentally affect you as a junior doctor per se? You know, if you, or can you think of any mistakes that you've made and how you dealt with it?
Yeah. Okay. So like I said before, talking to people is mega in this sort of profession. Learning from sharing experiences and knowledge is very key to this environment. And this is something that you'll never have all of the knowledge. You'll never be able to comprehend everything. You'll often never have all the information at the time. So healthcare environments, it can be very mistake prone. So a couple of things. I personally am very lucky to have not had any major medical mistakes, but one of my colleagues, they failed to recognize, when I say failed, there was a lot of stress going on at the time, but there was somebody that began to have signs of a stroke. So for those of you who may or may not know, that's when you might have a blood clot or a bleed in your brain, which means that you might start to have facial droop, slurring of your speech, maybe one of your arms or limbs doesn't work as well. And so when they were on call and they were bleep, but they were dealing with so many other stuff, when they were hearing that on the phone, they didn't go and see that patient straight away. And that it's not necessarily his fault entirely. There are many different factors that result in mistakes, and you can view it what they call as a Swiss cheese model with the holes. If a potential error goes through one hole, then it's blocked by another part of cheese, it's fine, the error is prevented. But in this case, with stroke was missed, that problem kept going through Swiss cheese hole to Swiss cheese hole, which ended up resulting in the fact that this stroke was missed for a good few hours, which delayed this patient's treatment and led to a poorer outcome.
Bro, the question, your mistake.
Yeah, I know, but I'm saying I don't have a severe, like a bad enough mistake.
Doesn't have mistakes. He's a perfect guy.
I wanted to pick a example which demonstrates how bad things can be.
Yeah.
But speaking to that colleague and knowing how bad and guilty that they felt at the time, that's important to have. It's important to have empathy, and that's why we're grounded in this profession. But it's also important to recognize that we're in a team here. We're not robots. We can't be perfectionists all the time, and we have to bear this responsibility together and learn from our mistakes. So that became like a learning event. We shared that information across the entirety of the team, and I think the key things to take from making mistakes is to know that they will happen. They're inevitable, but you can learn from that, share the learning points from your team, and always talk to people, because definitely consultants who have been in the field for many times, they'll always have those memorable patients where things didn't go quite how they wanted. And that's, I guess, the part and parcel is why the career is so rewarding, but high risk is just by the fact that it's so patient facing and you have that big responsibility. I think there's a good quote on that, is the fact that, you know, the first time you do something wrong, it's a mistake, but the second time you do it, it's a decision. Basically being learn from what has happened and then make sure it doesn't happen again. You know, if there's anybody who's ever speaking to me and they ever start by saying, I never make a mistake, I get everything right every single time, that I immediately switch off. That's a huge red flag, because the very virtue of doing our profession is at some point something will go wrong, and that's just life.
And the beauty of working in the healthcare is that usually there's a no blame culture. So when we do have a mistake, you know, a lot of people are focused towards trying to make that known to everyone so that everyone can learn from it, rather than being pointing fingers like you made the mistake, you're the cause of all the problems. So that's, I guess, in some ways that takes away some of the pressure, but obviously, you know, you still end up feeling quite bad about it. So in that case, Dan, what kind of services are there? Like, for example, from UK Doc as well. And I know the huddle is a really nice way of all the healthcare professionals to come together and talk about different things. Is that something that, you know, often people talk about, something that's happened at work? Just to kind of get things off their chest, or what else can we do? What else would you recommend that we do?
So I think, well, definitely around in Cambridge, what they're doing is that, well, they're starting to adopt the charity services. So they're introducing huddles within their hospitals that are provided through UK Doc. I mean, I think in general, what the huddle is doing is essentially is a structured area where people can come and talk about their day and you know, get support from their colleagues, which they may find difficult doing you know, within their own team. And essentially it's replicating kind of hopefully what their teams will be like in the future, and providing support like that. I mean, I think medicine's a weird one, because you are competing against each other, and that creates a slightly awkward environment sometimes, and sometimes you can feel that, especially when you're in hospital medicine. And I think you know, there will always be that edge of competitiveness, but ultimately it's about how you prioritize your own and others' well-being and emotional health. And you know, sometimes people have bad days and don't talk to you very nicely, and like, I'm sure they do. Like, I remember when I was at school, you know, I would have that. And actually, like, as I've got a bit older and my consultants have said, you know, usually those people are having bad days and actually probably need a bit more support than what you think. So I think if there's something that each and every one of you can do, is just, I guess, opening your mind a bit more and realizing that everyone, you know, is a human underneath their quest to become a medic, or, you know, if they're a doctor, they definitely do have a life underneath that profession that they're trying to look after.
Yeah, definitely. I think that's a really good takeaway point as well. And when you guys do become medical students or dental students as well, or if you are working already in that role, or if you're quite junior, sometimes you may get spoken to in a way that makes you feel like maybe it was your fault. You know, you asked a silly question, or you referred a patient that you shouldn't have, or whatever. But I think often it's just, you know, you don't know what's happening to the person on the other end of the phone. You don't know if they've just had a bad cardiac arrest that they've dealt with, and therefore they've got pressures really high, and they just kind of almost lash out at you. So it's never take it personally, and that's also quite useful. Another question, Dan, you mentioned earlier how a lot of the stuff that UK does, UK Doc, the charity does, is through evidence-based medicine. So what kind of evidence-based medicine or research has contributed towards the support that is available, or that UK Doc provides?
Sure. So we have a program called the Microstep program that was formulated by the public school of health at Harvard, so the T.H. Chan School of Public Health there. And then it was kind of trialed on the Mount Sinai hospital over there. And this specific area of microsteps, if we just look at them, they're available on our website. You can download them, you put them up in your hospitals or your schools. I think they're really applicable to doctors and non-doctors and students throughout. And they really focus on recentering yourself whilst you're at work, and you can do that whilst you're at school as well. So if you're having a particularly stressful time during that point in the day, they help you re-engage your brain, or if you're feeling a bit burnt out during that day, they help you try and come out of that mindset for that point in time. So that was a large cornerstone for one of our webinar series, actually. And then obviously with the huddle, And the tech support service, they're more traditional kind of support services that we've adapted and taken from practitioner health program, which provides services for unwell doctors. So we provide services to keep doctors well as unwell doctors, if that makes sense.
Brilliant. And also you mentioned earlier how there are opportunities for ambassadors, and these could be medical students or doctors, to get involved in research as well. And, you know, just to kind of let you guys, the prospective medics and dentists, know, you know, research plays a huge part in terms of your portfolio, even when you become a junior doctor throughout university. I think that is an incredible resource out there. So yeah, definitely something that you guys should look into, and visit the UOK website as well. And there's contact details for the team as well that you guys can reach out on. I've got another question for, I think, just the panel overall, and it's open to all of us, I guess, in a way, is how do we deal, or how do we cope with death in hospital? Or with our patients. So I think, Nav, do you want to start off there, and then we'll kind of go around?
You know what? When I started, actually, this is something I took from my colleagues. But when you go, if I talk briefly, to certify a death, you often have to go to the patient to look for signs of life and generally confirm that they have actually passed. At that moment, normally when I go do that, I normally just spend, outside of the examining the signs of life, I just spend a minute or so just in the silence. And sometimes I say a little prayer. I'm not religious myself, but a colleague, when I was a medical student, I saw them doing that. And I thought that was such a nice way to just, not necessarily honor, but recognize the passing of someone. And I felt like that helped me. Melisa talked about in her speech about reflection. This is a key moment for when people can reflect, and you can reflect in action in that moment, and you can reflect on it afterwards. So for patients that I've known for a long time, I might reflect with colleagues about them, their kind of care. But for the most part, as with anything, talking to people, reflecting on it, those are the main ways that I've dealt with it. I'll leave the other guys to open and discuss their own thing. I'm not sure you would have seen much of that.
I saw a couple of Max facts. But I'll let you guys first, and maybe I'll touch on it at the end, because I'm sure you'll cover the main themes. You guys see it a lot more often than I do.
I mean, I think it's a really good point. I think for me, just kind of building on that is being authentic to yourself, which it sounds like what you do. And I think, you know, invariably when you go and certify death as a doctor, you're usually an F1, so usually a first year doctor. It usually happens within your first couple of weeks, and invariably people tend to die or become more unwell at night. So it may happen on your night shift, and you may be kind of walking across the hospital to certify a death to a certain ward, and you go and certify the death, and then you come back, and you're not going to have a team of people around you. It'll just be something you've done by yourself. And I think there's always it's always good to have that period of reflection, and you will find yourself, at least I find myself, reflecting on that period, even if it was kind of an expected death. So in medicine, we have expected deaths where we know someone's going to die, and we make them as comfortable as possible in that area. So it may not be a particularly distressing or unexpected death, but it still, brings you back down, as a doctor, it brings you back down to the reality that you are dealing with life and death. And, from the very first flight, I remember the first person that I had to certify death on, and it is an experience that stays with you. And I remember having a lecture on this, and the lecturer said that he used to go and actually read comics afterwards if it wasn't a big on-call. So he, to make himself feel a bit better, because you will be on a night shift, or, hopefully it's not on a night shift, but sometimes it happens on a night shift. And just to make him feel better, so that's what he did, obviously before mobile phones came into being. And I think it's, trying not to ignore those feelings that you're having at that point in time is important.
Yeah, and you guys have touched very nicely on certifying this as well. So my previous job, the one I was just doing before my current psychiatry job, I was on stroke, and stroke has a lot of deaths. It's one of the leading causes of death in the world, actually. And no one can predict a stroke. So a lot of the patients would come in, some of them would have small strokes, some of them would have much larger strokes. And, in that sense, you would have a prognosis. You would often have to explain the diagnosis and the prognosis to the family. And that is when I realized how it is quite challenging to have those discussions with the family members, that your loved one is not conscious anymore because there's so much blood in their brain. A lot of their brain has died because of a clot. And they most likely are going to die in the next coming few days. And that is a really challenging conversation, but also at the same time, it is a massive privilege to be part of that family in that probably the worst moment of their life, to be able to ease any of their worries that they may be thinking of in terms of, you know, where would be a suitable place for their loved one to pass. You know, if that's going to be in a hospice, if that's going to be in hospital, at home. And I know we did a palliative care talk a couple of weeks ago, and that's something we talked about, or some questions that they just are not sure about. And you are that person that they will ask. And I think some of the most powerful conversations I've had were those moments. And it kind of made me feel privileged to be a doctor in that position, to have that conversation. So it's kind of like pros and cons, you know. It was a really challenging conversation, and it was really difficult, both emotionally and like mentally, and in a way almost physically as well. But knowing that it's made such a difference and made people feel a bit more comfortable in a really horrible situation is super rewarding as well. And Sun, did you want to touch on that as well briefly? I think before we ask the final question and kind of finish off the Q&A.
Yeah, sure. So I think obviously my experiences with it would be significantly less compared to you guys. And I think that's probably what made it a lot more surprising. You know, at no point when I was going through undergrad did I have talks about loss and things like that. I mean, well, generally the worst thing that happens in my life is you lose the tooth, right? But when I was doing a max fax job, so I was working in a head and neck cancer unit. So, you know, had some really unwell patients. But as he was saying earlier about you have those expected deaths, but it's the unexpected ones which you generally get. And there was this chap, he was 26, so roughly my age, and unfortunately he lost his fight with it, which wasn't one they were expecting. But it's the same thing about reflection, talking with your colleagues, things like that. So yeah, absolutely, as Dan said, you know, it's those things that will really help you to get through it. You know, it's appreciating also what you're grateful for, really.
Amazing stuff. And just to kind of finish off, just very quickly, just like some final comments on what would you tell people who are going to be embarking on the journey to our careers, you know, doctors or dentists who are applying for med school or dental school right now? Any final comments from you guys?
Take this time to do as much as you can to find out as much about it as possible. Truthfully, you will never know what it is actually like until you actually do it. And I remember when I was in your shoes, there are some people who maybe dropped out of medicine, and I was a student, prospective student, and I was thinking to myself, how could they do that? You know, these places are so competitive. How dare they squander that thing? But now being on the other end, I recognize that simply because the person you are when you first started you're a different person when you leave university. Life things change, your priorities change, you kind of realize more about who you are as a person. So everything you can do to try and work out whether or not this is right for you is a good idea. Being on this workshop itself, getting that kind of experience and advice and perspective from other practitioners down the line is a good thing to do. Getting work experience, I know, is really difficult in this day and age, but I would say those are things to consider if you can. But if you do embark on it and you do find that it's not the right thing for you, don't ever feel like you made a mistake going down that way, because you still find out a lot about yourself in that process. And I know many colleagues who have stopped maybe halfway through, gone to do other things, and they don't regret it. They see that those founding years were an important part of their life and gave them a stepping stone for what they wanted to do. So my main one piece of advice essentially is do the work and as much sort of research to see whether or not this is right for you, and that'll pay dividends later.
I guess touching on from that, my one, if I just give one line, is if you're in it for the right reasons after doing that research, it'll probably be the best thing you've ever done, really. Often if you go back like, I don't know, 20, 30 years, people often think like, oh yeah, it pays really well riding around Lamborghinis and stuff like that. If you're in it for that reason, you're in the wrong place. But if you're in it for the reasons, as we said, why we enjoy it, you're in the right place.
Last quick one, I would say, sorry.
Always use the last word.
Yes. Yeah, do consider, it's not on many people's radar, do consider taking a year out or a gap year. For both of us, that was very impromptu, not really planned. But that year gave me a whole new perspective
on just kind of what I wanted with life. Like me and Son, we got jobs working at M&S. We went traveling. We worked in a special needs camp in America, and getting those other actual life experiences was really important for us when we took it to university, because otherwise, if you're just going through school and you go straight to higher education, you actually miss out on like life, as cliche as that sounds. And those gap years, like Bakhtar took one as well. Maybe Son might have mentioned it, but going through those process that year out to kind of refocus and reorientate on what it is that you want to do with your life, gain like us a lot of motivation and skills for us to take in our uni years. But yeah, those are my, sorry to interject, but that's my other last thing is,
we'll shut up.
Consider it.
Amazing. And Dan, what about you?
Yeah, I think those are really, really good points. I mean, I guess my few points would be that you know, it is a journey. I mean, life is a journey, as cliche as that sounds, it is a journey, and medicine is a journey, and you guys are right at the beginning of it, and you'll think it will be this nice linear line from start to finish, and it may not be, and it may be for some of you, and I think that's really important to take away. Some of you know, I think that's crucial to take away. Also, I remember when I was doing my pre-med out in America, my bioscience degree, I got very overwhelmed by how much I didn't know, because essentially I hadn't studied any sciences since I was 16. And my supervisor was like, Dan, you need to, you know, you're looking at the whole cake. You need to look at one slice of the cake at a time. So one exam at a time. In America, you have a load of exams at universities. You need to do one exam at a time, do the UCAT course, sit that, then get into medical school, then focus on your first lecture, literally one thing at a time. And then that will build to the whole cake of you graduating, and then it will start again. And I think that's really important. And just like Nav and Son said, I don't think, I mean, for me, like my entry into medicine is a bit bizarre. And I think definitely if it takes a couple of attempts, or you have a different path into medicine, I think that can only help you. I think life experience will help you ultimately deliver good patient care, and be able to relate to patients maybe a bit better. And actually, like, I think, you know, if you do become on and become doctors and dentists, like, you learn so much as well from your patients, and you really learn that what's important in life is like having a good family around you, and you know, especially when you're unwell. And I think that's like just one of the greatest things that medicine can give back to you. So, yeah.
Amazing stuff, and I think that is the perfect place to end the Q&A as well, guys. It's been an absolute honor having you, all three of you, and then Melisa, I know she's already gone, but you, the guest speakers, you have done an amazing job at just giving the prospective medics and dentists, and also med students and dental students and other professionals in our talk today, just an idea of what challenges there are, hopefully normalizing a bit more, talking about these issues, making use of the amazing services that UCAT provides. And just remember as well, guys, you can, I'll bring on that screen again, but you can text doctor to 709702, donate £5 to UCAT, and then obviously the same code for the coupon to give yourself £5 off, so basically you don't lose any money in that sense. But yeah, it's been absolutely amazing having you guys here. So Nav, Son, Dan, you guys are free to go. The rest of the speakers, I'm going to take you guys through personal statement workshop, which is up next, and then a bit of UCAT stuff. But guys, thank you so much again. Enjoy the rest of your day. Nav, I know you've got a shift later on in the evening. Hope it goes well. It's been an absolute pleasure, guys. See you later.
Yes,
Thanks a lot for the opportunity, and good luck with everyone, to all your, whatever you end up doing.
And maybe we'll see you on the other side.
That's the plan. And guys, before we go into the personal statement workshop, what I'm going to do is, our sponsors, the Medical Defence Union, obviously we've talked about a lot of stresses, a lot of pressures, things about making mistakes. The Medical Defence Union is one of the biggest reasons of where I feel like if, things happen, mistakes were made, I feel like I would be protected in that situation. I mean, if I were to think almost like in a selfish way, if I made a mistake and it went to court or something like that, this is where Medical Defence Union comes in, and they provide me indemnity, provide all doctors, and then also the Dental Defence Union, who provide protection to dentists, and they will fight your case for you if it gets to that stage. Chances are, hopefully it never will, but just knowing that they're there. So I'm going to play you guys a short video, and it's mainly aimed at people who are the final year medics and dentists who have just finished your exam. So it's aimed at you guys, but also the rest of you guys applying for medicine and dentistry. Just be aware that MDU and the DDU are organizations that will also support you throughout medical and dental school as well. So they basically start from your journey as soon as you get into university all the way until you retire, basically. So I'm going to play a quick clip. It's only about 60 seconds long, and then we'll go straight into our personal statement workshop. Right, so that was that. And what we're going to do now is go back to our presentation. So the MDU is super useful. You can sign up. It's free during your medical and dental school, and you get like gifts as well. You get like little books and things that will help you with your exams and stuff. And one of the most important things that they did for me as well was just provide me cover for my electives. I spent 3 months of my final year abroad in America and South Africa as part of my fellowship that I was funded to go and learn more about emergency and trauma medicine. So they were providing me cover out there in case something were to happen. And I knew just, things would be taken care of, like nothing happened, but it's just nice to know that you are well and thoroughly looked after. Right, so now next up is what you guys, some of you will be very much looking forward to this, is we're going to do a personal statement workshop. So I've been getting loads of queries from you guys, obviously coming up to that time of the year where you're going to start writing personal statements. And as Dan said, you've got loads and loads of things on your plate. So think of it in chunks. You've got the UCAT to worry about. You've got your UCAS applications, personal statements, BMAT, GAMSAT if you're sitting there. You've got your A-level stuff. So much. This summer will probably be one of the busiest summers of your life. So the idea is, the Medical Life is here to help you guys through that one step at a time. So we've already done a few of the UCAT courses. We've got another 4 coming up in this season. I'll talk to you guys about that shortly. Personal statements is something we're going to be doing. Just to remind you again, we don't charge for personal statement reviews, but the only way you can get one is through prize draws, or if you refer a friend to a UCAT course. And again, if you come to the UCAT course, you'll get details for that. So make sure if you haven't already, take a picture of the screen or something, put it on Instagram, tag the Medical Life, tag the Dental Life, and we will announce the winner tonight. And we usually announce a winner pretty much every week. So personal statements, how to structure your personal statement. So I would divide it into, everyone's going to tell you different things. There's no right or wrong way of writing a personal statement. Okay, the whole idea is it's a piece of work that universities read to get to know you a bit more. It's supposed to be personal. So once you have a bit of an idea as to what you need to write, you can break it into 5 different sections. So the first section is your introduction. I'm going to give you examples of all 5 sections, give you examples from actual personal statements. So introduction, you've got your work experience section, then you've got extracurricular skills and achievements, you've got hobbies and stress management, and then your conclusion as well. So that for me, that's how I usually recommend people write their personal statement. That's how I wrote mine. That's how I got my little brother to write his. Also, just to let you guys know, the examples that I'm going to show you, they're all real examples from people who are currently either doctors or dentists or med students or dental students. These personal statements have been used in the past. So if you copy them, you will get plagiarized and therefore straight away rejected. Okay, so don't copy them. Just use them as an idea to give you guys some suggestions. Okay, I have to let you guys know because you'll get in loads of trouble because those people are already through. But if you like copied sentence or something, the university software will pick it up and you'll just get blacklisted. Okay, so just be careful not to copy, use it as ideas. Right, so the first thing, introduction. I'm going to read out a few introductions to you guys as well. So life is short, the art long, a powerful quote by Hippocrates that I believe summarizes medicine. Having lost several loved ones, I've come to the appreciation how short life can be, but also how monumental the role of a doctor is. Quite powerful opening. You can use quotes. Some people like to do that. And my biggest advice to you would be try and keep it personal to you. So if you are someone who does like quotes, then by all means you can use that. Okay, but don't feel like you have to find a quote, blah, blah, blah. So to give you another example, so the trust on which the doctor-patient relationship is built upon is what drives me to pursue medicine. Throughout my biomedical sciences degree, learning about physiology, pharmacology, and the human anatomy has allowed me to grasp the depth of knowledge needed to treat patients. So this is someone who's done a prior degree, who has learned a bit more than you would in A-levels about the human body, about the physiology, the pharmacology side of things, and that's pushed them to do medicine a bit more, right? So my greatest advice to you would be reflect over the next few coming days on what are the main reasons that make you want to be a doctor. Some of you, it's okay if you don't know exactly what it is, doctor or dentist, sorry, I keep saying doctor, but both doctor or dentist, and think about what are those reasons and then try and base it around that. The introduction is probably one of the hardest bits of the personal statement. So if you don't want to start with that, that's perfectly okay, but these are just some examples. Never-ending learning experiences, constantly changing scenarios, the ability to change lives daily. Medicine is the only career able to provide these opportunities and countless more. I have always been fascinated by biology and in particular the human body. From learning about the 5 senses to dissecting hearts and eyes, I was captivated by it all. Again, kind of using your experiences more from biology A-level, I assume, with the dissecting hearts and eyes thing, for example. Sometimes you get to do that at school. And I remember we got like fish and frogs that you got to dissect. So using your experiences that you've had that, you can think about what, if someone were to ask you, what did you like about your A-levels, or what do you like about medicine, then think about those and then you can start some sort of an introduction around that. Okay, so these are just some brief examples of what your introduction can be like. Don't worry too much about making it sound all fancy and everything. That will come later. Your first personal statement draft is going to be very different to your final draft. Okay, so get something down and then go from there. And just to give you guys the guidelines for personal statements, the limit for personal statement is it can be 47 lines long or 4,000 characters, whichever comes first. So 47 lines long or 4,000 characters. Just be aware that Microsoft Word, the way they use their algorithms to calculate things is different from UCAS. And I fell into that trap because when I made my personal statement, it was 47 lines long or 4,000 characters. I copy pasted it into the UCAS website and it was like 5 lines over. And I was like, what? So make sure that you're constantly checking your personal statement with the UCAS personal statement submission page to know that you're in the right limits. Obviously, initially you'll be well over limit, and then as you cut down more and more, you can start coming in limits. So these are some tips for you guys as well. Right, the next section will be work experience. And universities appreciate that because of COVID, because of the pandemic, you guys haven't had the chance to have in-person work experience, but this is where, the Medical Life Work Experience series, even days like today, are super useful for you guys to take away some really important points. And I think today was one of the best day in terms of work experience about the kind of things that you can reflect on that a lot of other people won't possibly know. So, a lot of people are not really aware of the challenges that, like Melisa was saying, no one told her the challenges that she was going to face as a dentist. No one told me the challenges that I would be facing as a doctor. It's only things that I saw when I was in 3rd or 4th year med school. So you guys are in a very unique position where you already know these now, and you can start thinking about those and start talking about how you would combat them as well. But yeah, so the first example, witnessing doctors console a couple that lost a premature newborn due to sepsis while still coming to terms with the loss themselves confirmed the importance of communicating empathy whilst remaining professional. These are qualities I show when taking observations and accommodating to the non-clinical needs of patients from various backgrounds since becoming a healthcare assistant at BMI Albin Hospital. So what I like about this is they've talked about something that was really moving and quite a strong experience that they were part of, and then relating it to themselves and how they use some of those skills. I think that is excellent. That's something that you guys can do as well. And, don't worry about if you feel like, oh my God, I'm not a healthcare assistant. It's something that you can do on a day-to-day. Maybe you have to console a friend that was feeling a bit rubbish after maybe they failed an exam or something. There's so many examples. With your personal statement, all you need to do is reflect on different scenarios and try to put something together. Throughout the hospital, and especially during the paramedic ED handover, I witnessed the multidisciplinary team communicate effectively while continuing with their individual roles to achieve a common goal. As the conductor of the school orchestra, I understand my responsibility as part of the team and happily delegate responsibilities to my other experienced members. My area of expertise being violin, I play at grade 8. Again, another example of something they saw. So a format that you guys can follow is give an example, reflect on that example, and then relate to that example. And you can see that in both those little bits. So give an example of what you saw, reflect on it. So what you learned from it, what was powerful about it, and then relate to it as something that you've done to demonstrate that. And both those paragraphs do that really well. The consultant assigned herself the role of team leader, and it was at that moment I realized the true importance of leadership and teamwork. A good leader does not give orders, but someone who delegates based on the strengths of the individuals before them and keeps the team focused on the end goal. These are some of the many examples where I observed the importance of teamwork, communication, leadership aiding patient care. So this one is more focused about the example and the reflection part. And then you can bounce off that in the next paragraph that we're about to come on to, which is extracurricular skills and achievements. Okay, so we've done introduction, kind of talked about how you can kind of give some examples from your work experience, and it's perfectly okay for you guys to talk about your work experience from an online point of view. And if you haven't watched the work experience workshop, the big event that we did back in March, that is saved on the Medic Life website, so you can go and watch that as well. We've got multiple different professionals talking about work experiences and their jobs and things like that. And obviously as part of the Medic Life work experience series, which is included for everyone who signs up for the UCAT course, every few weeks we do a work experience session that is only available to people who are part of the series. And the next up that we're planning is around problem-based learning and medical and dental school and the teaching styles, which is going to be super, super useful. So just for you guys to be aware of. Right, so extracurricular skills and achievements. So this one talks about mentoring a year 9 student at my school has helped me become more organized and develop my own communication and leadership skills through teaching in an optimal work environment. I also run the chemistry club for year 7 students, and they go on to kind of explain their role in that. So kind of like other things that you do. And again, you know, when I was in your stage, I used to think like, oh my God, I don't do anything extracurricular. What am I going to talk about? Trust me, I'm sure all of you do something on some scale or another. It's all about just thinking about what extra stuff have you done? You know, everyone goes to school, everyone does their exams. What other little bits that you do? You know, are you part of some projects? Or if you're not, this is a perfect time to get involved in something. Right? Maybe make a study group. Something a lot of my friends did back in school is, you know, one of my friends just started this applying to medical school group along with just a group of our friends. And Sun and Nav, we used to go to these talks as well. And that's something that you can do. And, you know, you can grab a few of your friends who are applying for medicine and dentistry, and all of you can work together. You know, if you want to come to the UCAT course, for example, what you learned from it, help each other, motivate each other, help each other with personal statements. Sun and Nav, they read my personal statement, they gave me feedback. I gave them feedback on theirs, blah, blah, blah. So things that you guys can do as well. And that kind of just some examples, whether you play sport on a particular level, whether you play a musical instrument or something like that. Volunteering with the SOS Children's Village in Islamabad, Pakistan was a rewarding experience on both a personal and professional level. My mornings were spent teaching various subjects to children aged 6 to 16, and I spent my evenings playing outdoors with them, creating lesson plans for the children further enhanced my organization skills, and this experience encouraged me to practice patience and compassion while being a strong leader. You could potentially talk about, so that bit, second bit is like my feedback from that basically. But yeah, that one, you know, really, really strong because this person's clearly done a lot. And by all means, don't feel like, oh my God, I haven't done anything like that. I definitely hadn't done anything like this back when I was applying for med school. But this is something that this is an example of if you have taught people, because in medicine and dentistry, teaching is a big thing. So if you have ever tutored someone, if you've taught someone, that's definitely something that you can talk about. I've balanced my academic commitments with several important roles I have at my school, including prefect, house captain, biology and chemistry mentor, and biomedical society leader. Through managing these varying responsibilities, I've honed my self-discipline and time management. So again, you can talk about if you have various different roles, whether be it at school, at university, at college, or if there's other things that you do, if you work part-time, if you have a YouTube channel, there's so many different things that I'm sure a lot of you have a combination of that you can then kind of put together. And essentially what you're trying to get across with this section of your personal statement is that you are a well-rounded person who is not going to get thrown off by trying to manage their time, because when you get to med school or dental school, when you become a doctor and dentist, you need to be organized. You need to be able to manage your time well. Because when you do the on-call shifts, for example, there's going to be lots of things flying at you from different directions. You need to be able to prioritize. And this is one of the things that I teach you guys at the UCAT course as well, for example, where the UCAT is designed to test your ability to do that. It's not just testing your math skill, it's testing your ability to organize your time organize how efficient you are, whether you can prioritize different questions based on assessing them very quickly and triaging them based on their difficulty levels. So that's something that we talk about. Okay. Then I would encourage you guys to put this in there, and I think this bounces off really nicely from today's event: hobbies and stress management. Medicine, dentistry, anything in life is going to be stressful, but medicine and dentistry are particularly stressful. So talking about some things that you do that help you just relax is a good thing. Okay, so a couple of lines, maybe a paragraph on your hobbies and how you manage stress. So school life can be very stressful at times, and being a doctor is no exception. So in order to de-stress, I play badminton several times a week and have practiced kickboxing for 5 years. So exercise, everyone knows that exercise is a major thing when it comes to dealing with stress, dealing with your mental health and your well-being. Yeah, studies have shown, and you can read a few papers if you like, and if you read books, and if you love reading books, if you read a particular book, you can talk about it, but studies have shown that in some forms of mild to moderate depression, exercise has been just as good, if not sometimes better, than antidepressants. So if you are someone who is a keen sports person or athlete or someone like that, or if you love a particular sport, or if you organize weekly football, netball, tennis sessions with your friends, then yeah, talk about it and how it helps you de-stress. Language learning and painting have supported my academic life by offering enjoyable but productive pastimes to indulge in. This not only maintains my management skills, but contributes to my facility as an individual. Again, excellent use of using some of those hobbies. So, if you are someone who can speak multiple languages, or you like to learn a new language, or if you're doing an A-level in a language, then you can talk about those experiences. Painting is incredibly therapeutic, yoga, things like that. If that's something that you like doing, then you can talk about it. And how it affects you as a person. And you can also talk about how it will help you going forward when you become a medical student or a dental student or a doctor or a dentist. Using photography as a creative outlet has allowed me to capture the intricacies of nature, developing my accuracy to detail. This would be an invaluable skill when interpreting diagnostic results and ability to consider an object from different angle. Similarly, as a set of diagnostic results or an unsolvable patient etiology. And again, this is excellent, using their hobby as a photographer to then relate back to medicine as well, or dentistry in this case. I don't know what this individual applied for, but it could be, looking at images and diagnostics. Again, if you feel like, what, I don't do this, that's okay. But think, and this is an example of how you can use something that you do and turning it around into a positive thing that you can then talk about in your personal statements. Okay. Right, conclusions. This is also going to be quite difficult. So with your introduction, you're kind of talking about why you want to apply for medicine or dentistry, whereas in your conclusion, you want to talk about why you are the candidate for them. Yeah, so that's the kind of difference between intro and conclusion. It ties everything together very nicely. So conclusion, I'm fortunate enough to have attained insight and experiences that have played a vital role in making an informed decision to pursue this highly rewarding vocation. I know that I have the resilience, personality, and academic capability to enter the field of medicine and succeed in it. So again, as in contrary to the introduction, which was talking about, I want to do medicine because of this is now the conclusion is talking about that you would make a good, strong candidate and a good doctor or dentist. Yeah, so that's how you want to word your conclusion and kind of bounce off some of the things that you've talked about in your personal statement. My desire to feed my love for science, demonstrate my caring personality, utilize my good manual dexterity skills, and a determination to succeed has confirmed that dentistry is the only profession for me. And again, this person talks about why dentistry is for them, but also what kind of characteristic and personalities that they have that they would make a good dentist. Yeah, again, something that you can kind of bounce your ideas off. Fortified by these experiences, I have grasped a fundamental realistic insight into the discipline. I understand medicine is an enormous commitment to a life of academic, emotional, and physical demands, but predominantly altruism. Nevertheless, I am certain that devoting myself to a vocation dedicated to indiscriminately improving quality of life will be fulfilling enough to last a lifetime. Again, quite a powerful conclusion, quite a bit of a mouthful as well, actually, which kind of gives you an idea that don't make too many long sentences because it can become a bit difficult to read. Kind of put yourself into the shoes of the personal statement reviewers as well. They have to read hundreds of these a day. Yeah, so your personal statement shouldn't be like something that you need to read over and over again. And I would, when you're reviewing your personal statement, read it out loud, read it to different people, and get them to kind of give you advice on what kind of things that you can tweak. Maybe you can write a sentence, and you can write the same sentence in a different way, and it will sound better if you write it in a particular way. So think about those things. And also you could try not to waffle, because you don't have the space or the words to waffle. So being concise and rearranging your sentences is a big challenge. And that's something that we do when it comes to personal statement reviews as well. So yeah. So essentially, in a nutshell, that is the structure with some examples for your personal statement writing. Okay. So you've got your introduction, keep it nice and short, couple of lines, a nice paragraph, maybe 2 paragraphs on work experience. Remember, it's about the quality of your work experience rather than the quantity. And the structure that you can use is you can give an example, you can reflect on it, you can relate to it. Yeah. Then you want to talk about your extracurricular stuff and your achievements, if you have any, and then your hobbies and how you manage stress, and then finally your conclusion. Okay. It will take you weeks to write a good personal statement. So get started on it early. Don't leave it last minute, because you just won't have time at the end. You don't want to just like kind of cram in your personal statement, because it will be obvious that you didn't spend too much time on it. So start soon, add a bit to it every day or so, or whatever. It can be part of your preparation for UCAT as well. Get loads of different people to read it. And obviously you can also apply for the Medical Life prize draw. So as I said many times, take a picture of this event today, put it on your story, tag the Medical Life, tag the Dentist Life, and you will be automatically entered into the prize draw. So that is the personal statement part of things kind of done and dusted. We'll do a little Q&A at the end if you guys have any questions about personal statement specifics. Okay, so we'll do a little Q&A after I've done the next section as well. So the next bit is about your UCAT preparation. Now, can I just get a show of hands on screen? How many of you have actually signed up or are doing the Medical Life UCAT course? Have you already done it, or you've signed up for it? So a few of you have, so well done. Amazing stuff. Okay, again, you guys can put your hands down for those of you not on camera. And those of you who haven't, we'll talk about the services that are available and how you can make the most of them as well. But yeah, so what I'm going to do very briefly, some of you guys may have seen this before. It's only a couple of minutes, so stick around, because I'm going to give you guys a certificate after that. But yeah, so let's quickly talk about some of the important dates. Okay, so I'm going to get my pen and start annotating the slides as well, which is going to be quite important. So registration for the UCAT has already opened. Okay, now I hope everyone has registered for the UCAT. If you haven't, you better do it today. And the reason I say you do it today is because registration bookings opens tomorrow. Yeah, so 9 a.m. tomorrow, less than 24 hours from now, UCAT registration UCAT bookings open tomorrow, which means from the 26th of July to the 29th of September, you can sit your UCAT anytime during those dates. Okay. The UCAT is going to get sat on in Pearson VUE centers. So these are test centers. If any of you have done a driving theory test, you go to these centers to do it. It's the same test center. You go there and you sit your exam. Now, fingers crossed, all my fingers crossed that COVID is just hopefully dealt with. And, the UCAT has done a good job with the vaccine program. So hopefully that'll be the end of COVID. But there are contingency plans in place, because last year, because of COVID, UCAT was pushed forward, and there was a very short period of time that people could do the exam. And then a lot of people ended up doing it at home. There were a lot of complaints from people doing it at home that their internet connection issues were there. So this year, UCAT is not letting people do it from home. But the contingency plan, if COVID kicks off again, is that they will then allow home testing again, which I would not be a fan of. So yeah, so try and get your UCAT done early, and we'll talk shortly about what kind of things you need to do in terms of preparation for your UCAT and how much time you need and all those resources that are available to you. So we'll talk about that soon. But yeah, so make sure if you haven't registered already, registered by the end of today, or as soon as this event is over, register. Test booking opens tomorrow, so go and get your test booking slot, because the slots go quite quick as well. Because you may be like, okay, you know what, I want to sit my exam on the 12th of August. Yeah. But if you leave it too late, all the appointments around that time are going to go. So the only thing you can get will be end of August or end of July, right? So you may not get the time that you want. So book it early. You can always change the date for free up to 24 hours in advance. So if your exam is like 1 p.m. tomorrow, you can still change it for free, right? So you can always move it back or move it forward, but just go and get yourself an original slot. There's also the UCAT bursary. So if you're entitled to the bursary, the UCAT exam is free, and so on. And these are some of the other dates of when things end. UCAT SEN is if you are someone who gets extra time in exams, then you get 25% extra time. So instead of a 2-hour exam, you get 2.5 hours. Again, you have to apply for that. You have to submit proof. That in itself takes time as well. So make sure you go and do that and apply for the bursary if that is someone that you're entitled to. 15th of October is the magic date for all medical or dental applications. Just be aware, you may see that there's 2 deadlines for UCAS. People applying for other courses and not applying to Oxbridge, the deadline is January. That does not apply to you guys. All of you guys applying for medicine or dentistry, your deadline is the 15th of October, right? So don't ignore the January deadline. That does not apply to you. Your deadline is the 15th of October. That's when everything needs to be sent off. Your personal statements, your grades, your UCAT has to be done. If you're going to sit the BMAT, then you need to tell them if your university applications, which courses you want to do, all of that. Okay, so get started on that soon. Now, most schools or colleges will have their own deadlines, which will be earlier. I will say you should all set yourself a personal deadline end of August. Yeah, end of August is when everything should be done for you. That should be your personal deadline. That leaves you a month and a bit to fix those final tweaks that you need to make on the UCAS website. Okay? Do not leave it last minute. So set yourself a personal deadline. That's like a month in advance of that because that's what you're going to need. Right, so how do I organize my UCAT preparation? So I'm going to start this off by drawing a little table to kind of show you guys how it kind of works. So if we do a graph on the y-axis, we put your score, so how good your score is going to be. And on the x-axis, we put time as time goes on. Your score and how much preparation you put in is almost like a bell curve, okay? It kind of goes up and then it kind of drops off as well. And what you want to do is you want to sit your exam when you're at your peak, okay? And that is different for everyone, but tends to be somewhere around the 4 to 6 week mark. And those of you who've already come to the UCAT course, you would have realized why we need this much time to prepare for the UCAT. But if you haven't, and if you haven't even started your UCAT prep, well, I'll talk to you guys over the next few slides what kind of stuff you need to do. But the UCAT is unlike any other exam you would have ever done in your life. Okay, it's unlike anything you would have done at school. Again, come to the UCAT course, I'll explain how, why. But yeah, it's different. It's almost like a skill rather than knowledge. For your biology A level, for example, you could read a textbook. If you remember everything, you go and regurgitate that, you get 100%. In the UCAT, things are not so easy. There's a time factor. This is probably the first exam that you're going to do in your life, which is designed in a way to make you not finish it, right? All exams that you've done in your life so far are designed to test your knowledge, to see how much you know, and therefore they give you enough time to do it, right? I had never run out of time of an exam in my entire life until I did the UCAT. And I've never run out of time for an exam since then either, right? Even through med school. So the UCAT was the only exam in my entire life that I couldn't finish because that's how it's designed. And that's how it's, and the reason they do that is because they want to test your ability to manage stress, to prioritize the different types of questions that come your way, to be able to triage to see which things require more urgent attention and which things can wait. All these skills are what I do on a day-to-day basis at my job. Whenever I get called or bleeped to go and see someone, they tell me what the patient needs, how urgent. I then have to look at my list of things, and put them based on how urgently I need to go and attend to that patient. Is it something that can wait a bit, or do I need to just leave everything I'm doing right now and run to this ward to fix this issue? Yeah, so that's something I have to decide on the phone and then decide what I'm doing. My current job, I'm on psychiatry. It's a non-residential on-call. So I do 24-hour on-calls. I do them from home. My phone goes off about 50 to 60 times a day, right? Sometimes even more. And every time I get a phone call, I have to decide, how urgent this is. Is this something I can do from my computer at home? Do I have to physically go in? Sometimes I have to go and see 5 different patients. Who am I going to see first? Which hospital am I going to go to first? Right? So all these decisions, and that's essentially what the UCAT is testing. So it's a skill that you need to develop. And just like any skill, it takes weeks for you to develop. And some of the techniques that we teach on the UCAT course are designed to help you overcome those challenges, but it's not something that you can just pick up in a day and become a master in. You learn something, but it takes you weeks to practice it. So it takes about 4 to 6 weeks to get to the stage where you are at the peak of your performance. After that, you start burning out. Okay, the UCAT is notorious for burning people out. Okay, you're going to start falling off the other end of the curve, and that's what you don't want to do. So if you ever start noticing that your grades or your scores going down, this is an opportunity for you to reflect on the fact that you are burning out and therefore take some time off Okay, take a day or two off. Make sure you give yourself enough breaks. A lot of people ask me is how many hours should I spend on my preparation a day? There's no right or wrong answer for number of hours. Okay, everyone works differently. It's more about the quality of the preparation that you do rather than just trying to hit the number of hours or the number of questions that you're going to do. I would split your organization into 3 sections. And again, if you don't follow the Medic Life on Instagram already, you really should, because I put posts up every now and then. And we did a few posts on how you can split this in a bit more of a detailed view, but I'm going to talk you through it as well now. So this is like your 6 weeks of prep split over 3 sections. We're focusing on 3 main things. The first thing that you should focus on is your accuracy, is trying to work on getting the questions right. Okay. The UCAT is super time constrained. There's loads of questions. So for example, it's a 2-hour exam. The first section is verbal reasoning for 21 minutes. You have 44 questions. Then you've got decision making. You've got another 29 questions and you've got 31 minutes to do it. Then you've got quantitative reasoning. You've got 36 questions, 24 minutes to do it, and so on. Okay. So it's very short amounts of time, loads of questions. So trying to figure out how to get those right, well, this is where the Medic Life UCAT course comes in. And I'm going to talk to you guys about that in a couple of slides time. But this is essentially where we go through all the different techniques that will help you get to the answer correct. And if you are someone who hasn't done, for example, maths for a while, because maybe you go to university and you haven't done maths since GCSEs, well, then this is your opportunity to go back and remember or revise some of those maths techniques. Just focusing on the maths stuff, the topics that come up again and again are percentages, ratios, fractions. You got probabilities as well. So I'm going to write that down there. Right, so probabilities. So yeah, fractions, ratios, percentages, probabilities, geometry stuff as well sometimes comes in. So for example, you want to know the area or circumference and that kind of stuff. So these things are quite common. So if it's been a while since you've done this is your chance to go and revise them. Probability tree diagrams also comes in, so go and revise that stuff as well. You want to then throw in some short quizzes. Okay, these can be like up to 10 questions per section to give you a chance to kind of practice the techniques that you've learned, but also try and get to the answer correctly, whether that be verbal reasoning, decision-making, solving the puzzles and decision-making, or quantitative reasoning, trying to structure your equations in a way that gets you the answer. So that's initially your aim here in the first week or 2 is working on trying to get to the correct answer, okay? And aim to do like a mock a week. The idea of doing a mock is it gives you an idea of what your score is, okay, where you are along your preparation. And in terms of your mocks, you have got 4 full mocks from the official UCAT website. Okay, these are going to be the most important resource that you have. Don't waste them at the beginning. Okay, and then again, I'll talk to you guys shortly about the Medify and Medic Life bundle, which gives you an extra 20 mocks on top of that. So you have more than plenty, you have more than enough questions. Okay. The next section that I want you guys to focus on in weeks 3 and 4 of your preparation is accuracy. This is where you can start doing mini mocks. A mini mock is a mock of just a 1 section. So for example, verbal reasoning, it'll be a 21-minute mock with 44 questions. With the Medify bundle, you get 40 of those, over 40 actually. So 40 plus of your mini mocks, again, loads of questions, and you can evenly split those throughout your preparation. I'll show you how in a couple of slides time. Mix those in with a few long quizzes. So overall, again, with the Medify bundle, you got over 20,000 questions. So questions is not a worry at all. It's about how you organize your prep. So you got over 20,000 questions. Long quizzes is what I mean by like 20 questions, 30 questions that you're doing in a quiz to give yourself the chance to practice your triaging abilities. And what I mean by triage is finding out which questions to do in which order. Okay. Now the UCAT is probably one of the first exams that you may have come across where it really relies on every time you approach a question to identify and make an educated guess as to how long it's going to take you to do that question. And pretty much every question is worth 1 mark. I know there's an exception. We won't go into that today, but every question is worth 1 mark. So some will take you like 20 seconds to do. Some will take you 2 minutes to do. So the idea of the Medic Life UCAT course is it gives you the strategies and techniques that you need to know. So as soon as you see a question, within like 4 or 5 seconds, you can work out if it's worth doing now or if it's worth skipping it and coming back to it later. And that's where long quizzes come in because it gives you the chance to practice those techniques. And then you've got one, and then I would recommend doing 1 or 2 mocks a week in weeks 3 and 4. Okay, so you can, and again, I'll show you using the calendar how you can schedule that. And again, the mocks help you build your endurance, because this is going to be an intense exam. Okay, 2 hours long, you're fully focused, highly focused to get the highest score possible. So it gives you that chance to practice that level of focus needed. And also, unfortunately, you're not allowed any food or drink in the exam room. So it gives you a chance to practice that and how you cope with it. And finally, the final 2 weeks, weeks 5 and 6, this is where you can start building in your official UCAT mocks as well, do more mini mocks, and you can do up to 2, or maybe sometimes some people do even more than 2, but I wouldn't recommend doing anything more than 2 mock exams a week, because you don't want to get burnt out. Okay, so really get yourself into that zone where you are practicing what it's going to be like exam day. A person who is ready, okay, is someone who's practiced enough that they go to their test center and they're not, yes, of course you'll be anxious, but they're just ready because you've done it so many times. You've done a mock, you know what's coming, right? You've done mocks, you know how the computer system's going to work, you know you're going to have a keyboard, a mouse, a noteboard, blah, blah, blah. And you don't feel like they're going to throw something your way, which you've never encountered before. Of course, there's going to be stress and there's going to be nerves and all of those things. You know, it's a big exam. It's an exam that you do once a year. And, you know, if you don't do well, then you have to wait till next year. But the idea is that you practice your techniques and strategies I'm going to teach you so well that it's all second nature to you. And if you're at that stage, you're guaranteed to do well in this exam, okay? The main reason people mess up this exam is when they let the nerves get the better of them. So part of preparation for the exam is controlling your own nerves, okay? Using those well-being and techniques and, you know, de-stressors in your life to make sure that you're at a stage where you feel confident and comfortable dealing with the UCAT. Make a timetable. Okay, I've just got a random timetable here. So let's say your exam is on the 28th next month. Yeah, so this is the big UCAT date. What you want to do is then split your week and your preparation into the 3 different modes that I told you. Okay, so first of all, we're working on accuracy, then we're working on speed plus accuracy, and then we're trying to simulate at the end. Okay, so the last 2 weeks. Because your exam is Friday, let's say at 2 p.m. if that's when your exam is, and again, you can decide when you want your booking. So this is what you decide tomorrow. Tomorrow is when you pick your test slot. And if you're a morning person, then pick your exam in the morning. But if you're someone who doesn't like to wake up super early in the morning, then pick in the afternoon. It's up to you, right? But whatever time your exam is, whatever day is on, I would recommend start doing mocks on those days, okay? Just to kind of get your body used to the fact that, well, Fridays is exam day. Okay, a lot of you guys would have finished school or university by now, so you got summer holidays coming up, so you can do that. In the final couple of weeks, you can throw in some extra mocks, let's say on Mondays as well. Okay, so these are your big mock days, and that's something that you can do. Then obviously the first few days, you're focusing on, you know, you got different things in the first 2 weeks, you're kind of working on accuracy. So if you're someone who's like, you know, I need a bit more work on percentages, well, then you can spend a couple of hours trying to learn percentages. And then if you like, you know what, after a few days, after you do a mock, you realize that your worst section is verbal reasoning. Well, you can spend a bit more time on verbal reasoning on Monday here and then Wednesday here. But at the same time, I want you to do all other sections every day. Okay, so this is everything. So a bit of everything every day, but focusing on particular sections. So for example, Mondays, you can focus more on verbal reasoning. Tuesdays, you can focus more on decision-making. Wednesdays, you can do, again, a bit more verbal reasoning, but you're also doing everything every day, okay? So don't forget that that's very, very important. Something that a lot of people make a mistake on is that all they think about is that the number of questions you do is everything, okay? That's not true. You can do all 20,000 questions and be completely static in terms of your preparation, okay? You may plateau because you're not learning anything from it. So the quality of your preparation is more important. So every time you do, for example, let's say on Monday, you're gonna do a mini mock on verbal reasoning, okay? And then you're gonna do everything else, all the other quizzes, but the main focus is verbal reasoning. And then on Wednesday, you're gonna do a mini mock on quantitative reasoning, okay? And again, don't forget everything else as well, but less of. But yeah, so those mini mocks, for example, this gives you an opportunity to analyze that section, but then reflect on that section. Make sure you review every single question, definitely the ones that you got wrong, but also the ones that you got right, because you want to see if there's a quicker way of doing the same question. right? So that's also very, very important. So yeah, so make a timetable, factor in, you know, these 2 days you're off because it's your friend's birthday, or it's your birthday or something. So you're not going to do any prep, you know, Sundays, day off, because you need to also make sure that you are looking after your mental health and you don't want to burn out. So Sundays, for example, could be days off, yeah, or take off evenings. One of the biggest mistakes I see people make is just going crazy with the prep, yeah, working like 5-6 hours a day on UCAT prep, not giving them any days off, just going absolutely crazy with the amount of resources that they're using. Not a good idea. Okay, be balanced in your preparation. Plan ahead, plan when you're going to do the mocks. When you are doing mocks, make sure your family knows, so you're in a quiet room doing it, no one's going to disturb you. Turn your phone off, you know, use the resources that are available to you. Recently I put up a post on Instagram about the keyboard shortcuts. If you're someone who has a laptop, get yourself a mouse and a keyboard. Okay, plug it in. These are extra things that you can do. Cost like £12 on Amazon. Buy one. Yeah, just so you can practice the format of having a similar keyboard to the one you're going to have test center. The test centers have very old school computers. They've got old school boring mouse and a boring keyboard. Yeah, so if you're someone who's got really fancy stuff, don't use that, because you're kind of practicing the format as well. It's all about building a muscle memory. Right. So the UCAT resources that are available. So we are very happy to be working with Medify. So the live online UCAT course, I did one yesterday. It was absolutely amazing. And we've been doing a few. I'll talk to you guys about the dates and stuff. Some of you have already attended that. Some of you already signed up for it. So yeah, mainly go through the time-saving techniques, but each section we go into massive detail, spend over an hour per section, talking to you guys about the techniques that you can use. And the idea is to practice those techniques over and over and over again to get to a stage where it's all second nature to you by test day. Yeah, and you use Medify's over 20,000 questions, 21 mocks and 40 plus mini mocks to then practice those techniques with as well. So yeah, so you get a full day live online UCAT course with me. I'm the only one who teaches the course because yeah, I've done it loads of times before, and I've been teaching UCAT for about 5 years now. Taught thousands of different students. So yeah, so that's on Zoom like today, but it's way more interactive. So we, you know, get you guys involved and the feedback. I'll show you what feedback we've been getting over the couple of slides as well. And you can read all the feedback on Instagram in the story highlights too, if you want. With the bundle, you get a 2-month subscription to Medify's question bank. So that's over 20,000 questions, 21 mocks, 40 plus mini mocks, and you get a season pass. So that's until October for the personal statement writer app. And that kind of helps you, guide you through writing your personal statement. Some of the dates that are available. So these are the only dates left now. So 4th of July, 25th of July, 1st of August, and 22nd of August for the UCAT courses. Now, the 4th of July course has been sold out for over a month, but I know some of you may want this. I've released 5 extra tickets for this, and these are just for today. Okay, so 5 extra tickets, and then the course is going to get sold out again. So that course is next Sunday if you're interested. The one after that we have available, because I'm not available for 2 more weekends after that, is the 25th of July. And I believe we've got 10 spaces left on that. So there's only 10 spaces left for this one. And then these 2 are available. So don't worry about rushing too much for those. But if you're interested in getting your UCAT done early, these are the 2 that you want to be focusing on. The live online UCAT course only is £55. So the UCAT course on its own is £55. The UCAT course with the Medify bundle is £90. But the Medify stuff alone is 80 quid on their website. Okay, so altogether you're saving £45. And don't forget the £5 off code that you get today as well. And yeah, so I'll show you that code again shortly. So these are the prices for it. Along with the UCAT course, you get free add-on, which is the regular work experience workshop. So these are where we kind of do loads of different teaching sessions. We've done one on stroke. We've done one on COVID. As Sun and Nav was saying, you know, COVID is a big topic. And the idea of the regular work experience series is that it prepares you for your interviews, which obviously are going to be in a few months' time, but we're going to start prepping you now. Okay, prepare you for your interviews, prepare you for your personal statements, and just make you more confident and give you a better insight into the careers that you want to embark on. Next event we're planning is going to be a big problem-based learning event. Okay, so it's where I'm trying to get like 10, 15 different doctors and med students and dental students to come together. We're going to break you all into breakout rooms, and we're going to give you a chance to be a medical student or a dental student for the day. Yeah, and you basically learn the way that I learned medicine. And why problem-based learning. It's a typical exam interview question where they ask you like, what are the pros and cons of problem-based learning, depending on which university you apply to, and you would have done it. You'll be like, well, I've done a session and this is what I loved about it. This is what I hated about it, blah, blah, blah. We have loads of different teaching sessions. We've done one on stroke, we've done one on COVID, we've done one on palliative care, we've done today on challenges in healthcare. Obviously, this was a bigger event because it was designed more for raising awareness, but these are only open to people who sign up for the UCAT course. Some of you guys may remember I got a few doctors from my hospital and we ran a simulation. We turned it into an interactive sim session. We're planning a few more of those as we go into the next couple of weeks and months, and then case studies and scenarios talking about interesting cases. And we get loads of different guests to come in to do that. So these are all only available to UCAT students who've signed up for the course, and it's free on top of that. I'll leave this on the slide on the screen a couple of minutes whilst we just talk about some things that you should be doing over the couple of next week. But these are just some of the feedback from yesterday's course, just some things that student wrote. But yeah, so the whole idea about the Medic Life is that it provides you a one-stop shop for everything that you need in terms of your UCAT prep. You've got your personal statements that you need to worry about, and then obviously any questions and advice that you guys need going forward. Because when I was applying, none of this was here. And in a way, it's kind of turned on its head. There's so many companies out there nowadays, so many resources. It's almost kind of confusing what to pick. And a lot of the time you'll see, you know, what you wouldn't see straight away unless you do a bit of digging is there's a lot of companies who just, you know, they start for a year. They'll say that they're experts in whatever they do, and run by very junior members or very junior people, and they kind of, because they've done it, so they feel like they can kind of go ahead and teach, but they don't have that legacy of like years and years worth of experience or people that they can bring in who've got years and years worth of knowledge. Okay, so there's a significant difference between kind of people who have just got into med school and therefore think they can then coach compared to someone who's been doing it for multiple years, has taught thousands of people. Okay, so just be careful which people that you I always say, be careful who you trust with your future, because yeah, some resources will be free, but just because something's free doesn't mean it's going to be the best out there, or at the same time something may be charged a lot of money, again, doesn't mean just because you're paying it's going to be the best resource. So yeah, so make sure you do your research accordingly. To show you guys again, this is the code 70970. You can text doctor to 70970 to donate £5 to this incredible charity. I'm so happy that we worked with UK Doc. And that again is the same coupon code that you can put in when signing up for the UCAT course. If you type in 70970 on the checkout page when you're signing up for the course, that will give you £5 off. And you don't have to, but if you want to, I would love it if you guys just donate that £5 off to UK Doc rather than giving it to the company that you would have done otherwise. So that's offer there just for today and tomorrow. Just to let you guys know as well, this winter we're bringing back the MMI courses, so multi-minute interviews. As Sun and Nav was saying, you know, they sat on the panel, so we get people who have sat on panels on interview courses, on different university interviews, for example. So Sun and Nav, they are the Medic Life interviewers. We also have Melisa, who you heard from today. She's also a Medic Life interviewer. So we have loads of different professionals. We also get medics and dental students as well. We have a whole host of different professionals who are our interviewers. So we run a one-day MMI course. Starts in the morning all the way until the late afternoon, early evening, delivered by doctors and dentists. You get 2 mock MMI circuits. So an MMI, obviously you're not thinking about that right now, but this is something for you to be aware of, is multi-mini interviews. You go from station to station, you rotate around, and you get asked different questions. You may have a role play, and this is something that's going to be coming your way around November, December time, when universities start offering interviews, because after you've done personal statements, you've done UCAT, you've done BMA, you've done GAMSAT, blah, 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 and then come the interviews. So it's something that we will help you prepare for as well. And you get loads and loads and loads of personalized feedback, okay? Tons of personalized feedback, like over 2 hours worth of personalized feedback in that day alone. So we don't believe in just general feedback. We think that's a bit rubbish. So it's more about tailored feedback for you that you will work on, okay? First year that we run it, like a couple of years ago, we did it in person. Obviously, because of pandemic, we then went to Zoom, and it was super fun and just as good, if not even better, because it meant people didn't have to travel ridiculous distances. We had people coming down from Glasgow and Edinburgh down to London just to attend the course. Whereas now it's all over Zoom, so you can just do it from home and it's just as good. So yeah, so keep an eye out for those. Just to give you an idea as how popular these were last year, I released the UCAT courses in 2 batches. The first batch sold out in 7 minutes of being released, and the second batch sold out within 15 minutes of being released. So yeah, so these are very popular, so just keep an eye out for these. And I'm thinking of doing like an early release, like 24-hour early release for people who sign up for the UCAT course as well. Cool, so that is essentially all the personal statement, UCAT, application stuff that we want to talk to you guys about. If you guys haven't seen it already, you would have received an automated email at 9 a.m. today. In that email is a link for the feedback form. Once you, this is the instructions to get your certificate, okay? So email, you would have received an email at 9 a.m., okay? There's a feedback link in there. Click on that feedback link and it will take you to a Google Forms page. Fill in that feedback form. It takes like 2 minutes. Once you fill in the feedback form, it will say thank you and give you another link. And that other link is where your certificate is for today. Okay. And that's only going to be available for you guys because you're live attendees, and I'm going to take that away afterwards. So once you fill in the feedback, don't cross it because it'll give you another link. And then you click on that link and it will give you the certificate, which you can download, you can print it out, you can write your name on it and put it in your portfolio for later on. So that's essentially the feedback stuff. So yeah. Now what we'll do whilst you guys are filling that in, I'm gonna also open it up. So I'm gonna now give some of you guys access, well, give you guys access for the chat box as well. If you guys wanna ask any questions in relation to, so you should now have access to the chat box, or you can unmute yourself if you wanna ask a question. But if you are going to ask a question, because we've got over 300 of you guys here, just so no one's talking over everyone, use the hand raise feature on Zoom if you have a question, and wait for me to ask your name and then unmute yourself and ask the question. So yeah, so if you have any questions, and I'm going to try and, I think the chat box is just going to go because there's going to be loads of people asking questions. So yeah, so if you can, it'd be better if you just unmute yourself and ask once I call your name for the questions. Meanwhile, you guys are filling in the feedback form. Let me make sure we got that here. So yeah, so amazing stuff. Got about over 50 of you have already filled it in. So yeah, just keep going, and then every time you fill it in, you get the link for the certificate. Amazing stuff. So questions, Deborah, do you want to unmute yourself and ask a question if you can?
Yes, thank you. Why are dentists not funded by the government?
It's different. I mean, that would be a better question for, I wish Melissa and Sam were still here, but essentially so the funding, NHS doesn't have that much funding to start off with anyway. Okay, so that's the first thing. Until you're 18, do you mean dental services, or do you mean like the treatment for dental treatments?
You know how the dentist said that they were self-employed, whereas doctors have a yearly salary. How come dentists don't have that kind of salary as well?
So some practices are NHS practices. Okay, so you will get NHS salary based on that, for example. But just the way it's been set up, and also this is something that privatization of the NHS is also taking place. So different services within the NHS are going to start becoming private as well. It just means that there's more competition out there, and there's pros and cons for being a private entity. It means that, you know, depending on what kind of services you provide, it basically levels the playing field and gets people to compete and provide the best treatment for resources out there. There's pros and cons, and you can read into privatization of the healthcare. I don't know exactly why that is. I'm guessing it's to do with funding. There's already not enough money in NHS just for medical stuff, let alone the dentistry side of things. So that could be one of the reasons. That's just how the government has decided those policies. But even within medicine, there's also private sectors. You know, you can get private surgeons, you can get private GP practices and stuff. So there's definitely a good question, and definitely worth doing more research on, because it's a question that can come up in your interviews as well.
Okay, thank you. Sorry, I just have one more question.
Yeah, sure, go for it.
What are your views on entering medicine via the biomedical route?
So there's multiple different routes to go into medicine. So you can either go straight after A levels, you can go after doing another degree, you can take a gap year, then you can go work in other sectors. I think it just depends for everyone. Having done biomedicine, you would be very familiar with the theory of medicine in the first 2 years. So you would find that stuff easy. Just be aware that applying for medicine after biomedicine, so once you've done another degree, your funding is changed. So you may not get like a big student loan. So you may have to think about how you're going to fund it for yourself, unless you apply for the graduate entry program. So funding is something to take into account. And graduate entry medicine is more competitive than normal entry medicine as well. So think about those things as well. So yeah, there's definitely multiple routes, and going abroad is another route as well that you can think about.
Thank you.
Amazing. Diab, you got a question?
Yes, hello. Thank you for answering my question.
No worries.
So I'm in year 13. I applied for pharmacy last year, and the question is about personal statements. So a lot of what I did last year was aimed towards, entering that kind of medical field. So when I am applying for medicine this year, a lot of what I did last year, the extracurricular activities, they come into use, if that makes sense, when applying. So considering it's my application, would it be considered plagiarism if I use a lot of the ideas I used last year? Because
so you can use the same
effective.
ideas. I wouldn't use the same personal statement, because you should tweak it anyway, because you don't know whether your personal statement was one of the reasons that you didn't get into med school or wherever you're applying for. So I would tweak it anyway, try and improve it in some way or another. I wouldn't copy paste like big chunks from your old personal statement into the new one, because it will get picked up by plagiarism software. So I would tweak it, and it's always a good habit when you're applying for a second year round just to change your personal statement. Obviously, using the same ideas is fine, but don't just use sentences that you just copy pasted over. Don't do that.
Okay, yeah, thank you. That's all I had to ask. Thank you very much.
Awesome stuff. Abby, you've got a question?
Hello, thank you.
No.
Oh, we've got two Abbies. We've got Abby with a hand up. So yeah.
Is that just Abby?
It says ABI on your name.
Yeah.
So I don't know who else is there.
For organising today, it was so useful.
Yeah.
I have a question about the Medify bundle you were offering. Does it include everything that a Medify website offers? So the 50 hours of video tutorials?
Yeah, it comes with all the UCAT. So the UCAT section is all of that, and then the personal statement section is all of that. So not the BMAT stuff, but it comes with all the videos and the tutorials as well, all of that stuff.
Okay, thank you.
No worries. And then we've got Nesrin. Got a question?
Hi, can you hear me?
Yeah, all good.
Thank you for the workshop. It was amazing and was so helpful. I just wanted to ask you a question. Like sometimes when we write our personal statement, for example, Medify has got a kind of
writer app. It's got useful.
Exactly.
Yeah.
If we send our personal statement to them, and then later on they send it with the correction, and then we correct it. Later on, if we submit it through the UCAT, it's not going to be plagiarism or something like this.
No, because submitting it to those services, it doesn't. You're not officially submitting it; it's only getting reviewed. So no, it won't get plagiarized.
And also another question. So I am working with the John's Ambulance as a volunteer vaccinator. Is this considered well? Sorry, is this gonna be good for adding this in the personal statement and showing that I worked in an environment of the NHS, for example?
Yeah, definitely. So that kind of counts as your work experience and also your extracurricular stuff that you're doing. So definitely talking about things that you've learned and taken away from working as part of St. John's Ambulance is super useful. So I would definitely add that in.
And last thing, the GP, the Brighton and Sussex virtual work experience, I've also done this, but I didn't get an opportunity to do any work experience in NHS, or like in the hospital or GP, because due to COVID-19. Is this also good enough to add it in the personal statement, showing that we understand what is working in NHS is like?
Yeah, so universities are aware that because of COVID, work experience has been a nightmare to get. So they will be accepting different forms of work experience. And it's not so much, some universities, like for example, Warwick, want a certain number of hours and they need you to prove it, whereas other universities will be happy with you just explaining through reflection what you've learned. So yeah, so don't worry about exact number of hours. It's more so what you've learned from it, how you can reflect on it. That's more important.
I see. And when do you know that you are burning out of extra practice of UCAT?
So it's to do with, like, for example, when you get to the stage where your grades are kind of falling off the other end of the curve, and you'll feel it yourself. You'll feel like you're exhausted, you're getting more frustrated and that kind of stuff. So yeah, Nesrin, I'm gonna stop you there. I'm gonna ask other people some questions as well. If you have any further questions, you can always email in. Just because I know we've got loads of different people questions, and I've only got about 10 minutes to answer.
Thank you so much.
No worries. Thank you for your questions. Annie, do you want to unmute yourself and ask your question, please?
Hi.
Hello.
Can you hear me?
Yeah.
Okay. So basically, is it right that we only allowed to choose 4 medicine courses and the 5th one will be our backup one?
Yep, that's correct. So 4 applications to medical school, dental school, and then 5th backup choice.
Yeah, so would you recommend that we write another personal statement to that 5th option?
Your personal statement should be more geared towards your primary options. You can mention very slightly for your 5th option, but I wouldn't, and most people don't. Unless your 5th option is also very competitive, in which case maybe, but I would focus your personal statement towards the first 4 options.
Okay, so we just write only one personal statement.
Yeah,
to
you
that
only write,
4th.
yeah.
Okay.
You only write one personal
that's
statement that gets sent to everyone, and most places know that. So most places know that your personal statement is geared towards medicine or dentistry, and therefore, if you've picked like biomedicine or if you've picked like biochemistry or pharmacology, the degrees that a lot of people will also have interest in if they don't get into med school or dental school, those universities know that this person is applying to us as a backup, so they understand that, and they may still invite you in for interview, for example.
Okay, yeah, that's fine. Thank you.
Thank you. Right, we've got Mohammed. Do you want to ask your question, please?
Well, hello. Thank you for taking my question. Am I audible? Can you? Can you
go for it. Yeah.
Yes. First of all, thank you for the wonderful conference. It was very helpful. So one thing I needed to ask is that as you're aware that there's a large amount or a number of people that apply to med schools from all around the world, international students. So what do you have to say for an international student? What would you recommend to them? Because I think it's a bit different if you're coming from international background rather than coming from a domestic background. So
yeah, definitely. And I would, no matter where you live, you still got exposures to healthcare. So you can still talk about your experiences. I would still follow the same structure because the structure doesn't really change. So you still got introduction, your motivation for applying for medicine or dentistry, your work experience bits. So no matter where you're coming from, you can still go and get some work experience in the healthcare that is provided in your country. You can also then talk about why do you want to come to the UK to apply, for example, what are the changes, what motivates you to come, to expose yourself to the National Health Service in the UK. What is it that you like about the NHS that makes you want to be a doctor or a dentist for the NHS, for example?
All right, and one more thing, I'd like to I'm pretty sure that you would have you have in your time in your med school, I think you have met lots of people who came from international backgrounds. Would you recommend doing anything if you're especially you're a national student to a national student? Anything that they should know?
Just be aware of the different, read up on the news on the UK healthcare system, for example, just to be aware, because when you get interviewed, that is something that you will get asked about quite a lot, your motivation for applying to what's happening in the UK and why do you want to be a doctor in the UK and that kind of stuff. So just be aware of that stuff.
Okay, thank you very much. Thank you.
No worries, thank you. And then Mehek, you've got a question?
Hiya.
Hello.
I was just wondering whether it would be advisable to put a competitive course as the 5th option, because I was thinking of putting dentistry for my 5th and then medicine.
You won't get in for that. That'll be a waste of choice.
Okay.
So if you're applying for if your personal statement is geared towards medicine, dentistry, they'll see it. They'll be like, this person's clearly not interested in dentistry if they've put us down as 5th option, and they'll just reject you. So your backup option should be something that is not as competitive but similar, where the personal statement would work. So majority of the time it would be, you can apply for things like biomedicine, pharmacology, biochemistry. If medicine is the only thing that you want to do, then, most universities will be aware of that. But if there's generally 2 different courses that you want to do, if you are generally if you don't get into medicine, you'd be more than happy with doing something else, and apply for that and just see how it goes. And sometimes universities will invite you for interview anyway, just to kind of gauge your motivation for that other course, but it wouldn't be like dentistry. They won't even look at your application.
Great, thank you.
In my opinion, but yeah. Cool, thank you. And then Muntaha, you got a question?
Yeah, hi.
Hello.
I was thinking about applying to biomedical engineering as my 5th option.
Okay.
Do you think I should write a different personal statement for that, or is it similar?
So you only write one personal statement that gets submitted for all 5 of your options.
Okay.
Option is biomedical engineering. Maybe you can put in a couple of lines about biomedical engineering and your experiences in that, if you like, because you can relate it to medicine, for example. But it'll be the same personal statement that goes everywhere. And depending on which university you apply to, if it's a very, very competitive university, they may not take you, because some people just want to do biomedical engineering as their big passion, so they would get over, so you'd get overlooked over those people. But if it's something where it's not as competitive, then you would be taken into consideration.
Okay, and one quick question, because I know there's other people. How do I access the question bank and personal statement write-up? Because I bought it, I just don't know how to access it.
So you should have got an email from Medify. So all of you guys, once you sign up to the UCAT course, within about 24 to 48 hours, you get an email from Medify with your login details. Sometimes that email can go into your junk folder. So make sure you check your junk folder. If you still haven't got it, you can go onto the Medify login page and you can click forget your password and enter in the email address that you used to sign up for the course, for the Medical Life course, and then you'll get a new email. If that doesn't work, then just email me and I'll try and sort it out for you.
Okay, thank you.
Cool, thank you. And then we've got Krishi. You got a question?
Hi, good morning. It's night for me here, but I was just wondering, are you disadvantaged if you do not have as many academic achievements or extracurriculars? And if so, how do you make up for that difference to still be competitive?
So just like Dan said, for example, Dan didn't have many academic stuff, didn't have much research, he just done other stuff. So if your passion comes through that you really want to do medicine, I am someone who's not that academic, like I haven't got any research papers or anything like that, but my passion comes through. So every interview I've been to, I've won fellowships and I've won like scholarships and stuff, because mainly on my passions. So on paper, you may not be as strong, but once you tick boxes, some of those boxes, for example, for you, UCAT would be a big box. As long as you meet the grade requirements, you're okay. And then they interview you, and that's when they'll realize that, you know what, you are someone who's quite passionate. And then that'll be enough. So that's where the MMY courses come in later on in the year, where we kind of help you guys to showcase your passion and your true energy for what you want to do.
Thank you.
Amazing
stuff.
stuff.
I meant to ask, what was your unique, I mean, I'm pretty sure every doctor has the same reason about, wanting to go into medicine, but was there anything unique in your circumstance which drove you to choose medicine?
I mean, there are loads of reasons. Like, it's some of the standard stuff, for example, in the case that I loved science, I wanted to apply that to help people. But I guess the unique thing was, like, my dad was an orthopedic surgeon, so I was always like inspired to be like that, to be a doctor in some way or another. So that was kind of like, I had exposure to medicine from a very young age. And it's something that I always looked up to and something that I wanted to make out of my life. So that's what I guess was a bit unique for me. But you don't always have to have something super unique. It just it can be something simple. It can be something like you love science, and going forward, use your passion to help others. And that's something that you can do.
Right, thank you
Amazing
so much.
Stuff. Thank you. And then we've got Nimra. Have you got a question?
Hi. First of all, thank you so much for today. I've got two quick questions. First question is, for your backup option, if you're applying to like biomedical or pharmacology and you're doing it to the same university that you're applying to medicine for, would it disadvantage your medical application?
It shouldn't do, no, because the universities will see it as two separate applications and they probably won't really even know. Don't quote me on that, because I'm not an admissions officer, but they will treat it as two separate applications, so no, it wouldn't disadvantage.
Okay, and number two, do you have any recommendations for any other like research projects or supercurriculars that you'd recommend that could boost your application?
In terms of boosting your application, you can do like EPQs and something that you're passionate about. So extended projects, and so EPQs are great. You can contact your university or your college or wherever you go, and just do some extra research in that kind of sense. Or just like you can do your own little project as well, where you can kind of talk about something that you're passionate about, do some research on it, gather some feedback from your friends and write it up somewhere, and just like write some sort of a report and maybe show your teachers or your professors to see what they think. And you can do your own little project. It doesn't have to be like an official thing.
Okay, thank you so much for your help.
No worries. Guys, we'll take a final few questions. I'm just quickly scanning through the chat box as well. That's kind of going a bit haywire as well. So how quickly do the spaces get booked up for the UCAT? As I was saying, like quite quick. We haven't got many spaces left at all for July anymore. So previous work experience sessions, as soon as you sign up for the, you'll get sent a link with a Google Docs link in it, and the Google Docs link has all the links for all the previous work experience sessions that you can watch. Does the Medify bundle include everything, such as the Medify UCAT videos? Yes, it does. So when we buy the UCAT course, we'll be able to join the work experience sessions for free. Yes, you can. apologize. Where can we find the feedback form? Oh, let me email you guys the feedback form again if you guys haven't got it. I'm just going to pop it in the chat box so you guys have access to the feedback form in case you haven't had the chance to fill it in. So yeah, just quickly scanning through that. And then how to download the certificate. So yeah, as I was saying earlier, once you fill in the feedback form, you will get a link, go onto the website, the Medic Life website, download it. There's a button in the top right corner, which you can click to download it once you open up the online PDF viewer and just print it out or write your name as a PDF and save it in your computer. Do we list hospital names in our personal statement or not? You can, you don't have to, but you can list personal or hospital names. What do you do if you don't get your predicted grades? So there are options. So obviously this year, a lot of the grades are teacher assessed, so center assessed grades or teacher assessed grades. And then you have the option to then sit your exam in October if you don't like your grades. So that's something that you can do. Obviously, if you then sit your exam in October, you then have to wait for your results and blah, blah, blah. And then your application will be deemed on that. But those are some of the options that you have available. When's the best time to do the UCAT? I would say as early as you can, okay? Don't leave it late because you've got other things to worry about. So do your UCAT early. For all of you guys who are here today, you know, this is still quite early on in the season. So try and get it done by the end of July, early August, mid-August-ish. Don't leave it too late because you've still got your UCAS, you've got your personal statement. Bear in mind, school starts again or universities start again in September. So don't leave it too late because you've got those things to worry about. If for some reason you don't like your grades in August when the grades are released and you want to do the exam, you have to obviously revise for your A-levels. And that's going to be something that you do in the later August and September part. So obviously you don't want to be revising for your exams and the UCAT. So again, another reason to get your UCAT done nice and early. What else is there? Do you think we should talk about COVID in our personal statement? If COVID affected you in a way that you do want to talk about, by all means you can. Can universities see what options you've put down? No, they can't. So only the university that you've applied to can see that you've applied to them, and that's it. They don't know where else you've applied. How quickly do UCAT places get booked up? So yeah, as I was saying earlier, the ones for July, I think there's just a couple of spaces left now after today. Can anyone recommend any apps which help with UCAT? So apps wise, I would recommend Medify. There's loads of different companies out there. As I was saying earlier, there's a lot of new companies come along and they pretend like they're amazing, but you know, Medify has been there the longest. It's what I used about 10 years ago. It's why I recommend all my students to use and that kind of stuff. So yeah, and with the bundle, you save £45 if you get that. So that would be my personal opinion that you go for. Can we access a recording? Yep, you'll be able to access it later on. I'll send you guys an email how you can access it. Can you apply for medicine through clearing? You can, but it's very, very competitive. And I think last year was one of the first years ever where they had some spaces through clearing. Most of the time they won't. Is it worth applying even if you score below the UCAT cutoff score? So most universities won't tell you exactly what their cutoff scores are. They'll just tell you what last year the cutoff was, and every year the cutoff can change. So even if you are below the previous year's cutoff score, you know, depends on your application. You may still get an interview. There's other factors that they look at. They look at UCAT, your grades, your personal statement, loads of different things. But I would recommend doing your proper research. And one thing a lot of people don't do that you can do is you can just call up the university or send them an email and ask them what they think. Cool. Can we talk about secondary achievements in our personal statement within extracurricular skills? You definitely can. Should we book the UCAT exam ASAP? I would book it ASAP, yep. UCAT bookings are opening tomorrow, so that's when you can book your UCAT exam from the 26th of July till the 29th of September, anytime in between. Would you say that pharmacy is another fifth option that would be disregarded your application if it's focused on medicine? It depends which university you apply for, because some universities are more competitive than others. And then the final question, any support for BMAT? Unfortunately, this year we're not doing a BMAT course, but from next year onwards, we are planning on doing that as well. But again, Medify, and there's loads of official BMAT past papers that you can do online. How do you apply for the UCAT? So do you mean the LIBOR? Do you mean the course to the course, or do you mean applying for the UCAT? So if you want to come along to the UCAT course, go onto the Medic Life website. If you want to apply for the UCAT, you go on the official UCAT website. So those are the two ways about it. Guys, I'm going to leave it here. If you have any further questions, you can always message me on Instagram. You can email me. I will get back to you after a while. I hope today was useful. I'm absolutely thrilled by the number of people that we had join today. So thank you, all of you today, for coming along. Remember, if you haven't signed up for the UCAT course, make sure you do that and come along. We'll teach you loads of amazing stuff. Good luck with your preparation. Remember, you're not alone. It is going to be stressful, but make sure you look after yourselves. Make sure you talk to your family and friends. If you are worried about anything, you can always reach out to me as well. I'll be more than happy to help. Sometimes it can take a while before I get back to you, but yeah, we're all in it together. So good luck. I will email you guys the recording for this session in the next few hours. I've got like 3 more meetings today. So yeah, so once all of that is done, but guys, it's been an absolute pleasure having you all today. Thank you so much. And thank you again to our sponsors, the Medical Defense Union, UOK Doc, and the other amazing guests, Melisa, Sun and Nav, and Dan as well. Look after yourselves. Good luck with your applications. Happy prepping, and see you guys later.